जी सर, अभी सही चल रहा है।
Mic testing. Okay, guys, I'm audible. Can we start the session? Mic testing. Okay, guys, I'm audible. Can we start the session? Okay, good afternoon, everyone. So now we'll discuss the rapid review of pathology. So meanwhile, I'm also seeing your messages, so you can ask your messages, your doubt straight away. So we'll learn through some images here, right? So I'll talk about certain image-based question. Then we can also talk about some basic aspect of pathology. So starting now, few days are left. So जब तक ये खेल खत्म नहीं होगा अपने दरीचे. So let's get started with our first thing. So this is, you can see we have different types of necrosis. Yes, we'll do use both language, Hindi, English. Done? Okay guys, शुरू करते हैं. So look at the screen first. ध्यान से देखो. So first focus on this. This is a typical wedge shape infarct. A typical wedge shape infarct. Then here sometime you will see, you will notice nucleus कभी कभी गायब हो जाएगा. Sometime nucleus is there, sometime nucleus is not there, right? So this is what we call this coagulative necrosis. So this type of necrosis is called as coagulative necrosis. So coagulative necrosis, understand this thing, this is most common type of necrosis. It is most common type of necrosis, and sometime in this necrosis nucleus will disappear, right? You will see typical wedge shape infarct. कभी कभी nucleus गायब हो जाएगा. When nucleus sometime disappear, what we call this? इसको क्या बोलते हैं? We call this ghost body. We call this as ghost body or ghost cells. Right? ये rapid revision है. PDF will be shared. So अभी तो ये page number पहले ही है. Daksh, am I clear? So understand this thing. This is most common type of necrosis, and this is seen in most of the organs. It is classically seen in heart. It is classically seen in heart, and this is something which you will never see where? Never in brain. It is never seen in brain. Done? Okay, moving to next type of necrosis. तो यहाँ पर आपको दिख रहा है, you can see here, this is pus. This is pus, or I can say a purulent discharge, pus. So this type of necrosis is also called as liquefactive necrosis. एग्जाम में क्वेश्चन पूछते हैं व्हाट इज अनदर नेम ऑफ लिक्विफैक्टिव नेक्रोसिस. सो अंडरस्टैंड लिक्विफैक्टिव नेक्रोसिस इज आल्सो कॉल्ड एज कॉलिक्वेटिव नेक्रोसिस. लिक्विफैक्टिव नेक्रोसिस आल्सो कॉल्ड एज कॉलिक्वेटिव नेक्रोसिस. सो दिस इज जनरली व्हाई इट अकर, क्यों होती है? इट अकर ड्यू टू एंजाइमेटिक डिग्रेडेशन. इट इज सीन ड्यू टू एंजाइमेटिक डिग्रेडेशन. Coagulative is due to protein denaturation. It is due to enzymatic degradation. Now understand this thing. This type of necrosis, collicutive or liquefactive, it is classically seen in three places. So where we see this? It is seen in brain. Any part of brain, means like ischemic stroke, hemorrhagic stroke, any type of abscess, किसी भी तरीके का abscess. And this is seen in pancreas. Because in pancreas you will see action of amylase lipase. So what are these? These are enzyme. So it is due to enzymatic degradation. So this is called liquefactive necrosis. Now moving to third type, which is a combination of two. So here you can notice, अगर आप ध्यान से देखोगे, you can see here this is like a cheese like material. अ चीज़ लाइक मटेरियल, एक चीज़ जैसा, जैसा जब पनीर हम दूध से फाड़ते हैं वैसा मटेरियल दिख रहा है, तो दिस इज अ चीज़ी नेक्रोसिस, or I can say a cheese like material. You will see this is something which is a combination of coagulative plus liquefactive. It is something that occurred due to combination of coagulative and liquefactive necrosis. And classically, the classical example you will see this where in tuberculosis, in sarcoidosis, and systemic fungal infection, right? Systemic fungal infection. कोई बताएगा? Madan, Daksh, try to answer. Which systemic fungal infection will not have this? So remember mucormycosis. Mucormycosis में ऐसी नहीं होगी, right? How to deal with short subject? Answer is simple. Just short subject. Understand this thing. You need to revise this for 6 hours, 6 to 8 hours maximum. एक बार सारे क्वेश्चन कर जाओ या फिर एक बार थ्योरी पढ़ लो. That's it. गुड मॉर्निंग. ये मेरे नाम से कौन गुड मॉर्निंग कर रहा है मुझे? ओके चलो कोई नहीं. ओके कमिंग टू दिस. यार नाम रख लिया, नाम की इज्जत भी रखना. चलो आगे आ जाओ, वापस आ जाओ. Come back to next type of necrosis. We have fat necrosis. Fat necrosis, you can see these fat globules. You can notice these fat globules. So these are fat globules along with calcium. So this is fat necrosis. So this is seen wherever we have fat. तो जहाँ पर भी आपको फैट मिलेगा वहाँ पर क्या होगी? फैटी नेक्रोसिस. नाउ अंडरस्टैंड दिस थिंग. दिस फैट नेक्रोसिस यू विल सी वेयर. This is something which we see where in breast tissue. So this is seen in breast. It is seen in omentum, and this is seen surrounding the pancreas. Surrounding the pancreas means it is seen in peripancreatic area, or I can say peripancreatic fatty layer. We also call this adipose tissue layer. Right? So this is about fat necrosis. And understand this thing, wherever we have a lot of fat, you will see fat necrosis. So what you have to remember, just remember this breast and omentum, because these are the questions that they ask in exam. Moving to next type of necrosis, we call this fibrinoid necrosis. Fibrinoid necrosis. So understand this thing, fibrinoid necrosis you will see wherever we have type 3 hypersensitivity. So type 3 hypersensitivity को क्या बोलते हैं? What do we call this? Anyone? Type 3 hypersensitivity is also called as immune complex type. तो जहाँ पर immune complex बनेगा, wherever you will see immune complex formation, you will see this type of necrosis. So type 3 or fibrinoid necrosis, where you will see this where in a patient with SLE. You can see this in a patient. और कहीं मिलेगा anyone? With PAN. PAN means polyarteritis nodosa. You can see fibrinoid necrosis in rheumatic fever. And the last one which you have to remember, you can see this in a patient with malignant hypertension. In rheumatic fever, because of fibrinoid necrosis के चलते, what you will notice, you can notice there is formation of a body, and these bodies are called ash of bodies. So this is about your fibrinoid necrosis. Okay, let's now try to understand. Look at the screen and try to understand. So this is a normal cell. So if you see the microscopic view, then you can notice pycnosis. Pycnosis means there is shrinking of cell. So pycnosis का मतलब क्या होगा? Pycnosis means there is shrinking of cell. So nucleus का अगर size छोटा होगा, we call this pycnosis. So focus here. This is pycnosis. Now when nucleus will be fragmented into pieces, अगर nucleus के 4-5 टुकड़े हो जाएंगे, this fragmentation is called karyorrhexis. So nucleus fragmentation is called karyorrhexis. And third is karyolysis, means you can notice nucleus गायब ही हो गया. There is no nucleus. So nucleus disappear. So when nucleus disappear, we call this karyolysis. So these are like pycnosis, fragmentation, or karyolysis. These are the changes. These are the changes where we see this where in IRCI. IRCI means irreversible cell injury. These are the changes you will see where in irreversible cell injury. Done? Irreversible cell injury. ओके नाउ फोकस ऑन दिस. इस पर फोकस नहीं करना है, फोकस इधर करना है, इस पर. दिस इज कॉल्ड स्टेप लैडर पैटर्न. You can see this pattern, step ladder pattern. The step ladder pattern you will see where? Step ladder pattern you will see in apoptosis. Just one more thing, remember, necrosis will have smear pattern. Necrosis में smear pattern होगा. This step ladder pattern, understand, this step ladder pattern you will see in apoptosis, and they ask you a question, why we get step ladder pattern. So step ladder pattern, right? Step ladder pattern occur because of which enzyme? It occur because of endonuclease. It occur because of endonuclease, right? Step ladder pattern. Done? Okay, now we have a rare type of necrosis. We call this gangrene. So we have two forms of gangrene. दो तरीके के gangrene होते हैं. We have wet gangrene. So just try to understand. Wet gangrene means यहाँ पर आपको pus मिलेगी. So when you see this pus, this is called wet gangrene. So understand this thing. This wet gangrene is something. In this wet gangrene you will find more coagulative necrosis. In wet gangrene you will find more coagulative necrosis. Sorry, here you will find more liquefactor. In wet gangrene you will find more liquefactor. And if you compare this with dry gangrene, this is dry gangrene. This dry gangrene will have more coagulative necrosis. So understand this thing. So we have wet gangrene and dry gangrene. So dry gangrene सूख जाएगा means more coagulative necrosis, and wet gangrene will have more liquefactive necrosis. Okay, now coming to metaplasia. So understand, metaplasia means change of epithelia. So it is nothing, it is change of epithelia. So when I talk about change in epithelia, most common cause will be smoker's lung. So most common cause will be smoker's lung. So याद रखना, एक common mistake student make, most common cause is not Barrett. So most common cause will be smoker's lung. Most common cause of metaplasia will be smoker's lung. Done? So what happens in smoker's lung? Understand this thing. Columnar epithelia. This is columnar epithelia. This will convert into squamous. इसका exact उल्टा, just exact opposite of this. Squamous is converting into intestinal type of columnar. That is something which we see in Barrett. So exact इसका उल्टा means squamous epithelia. This will convert into columnar. And this columnar is special because here you will find goblet cells. And this is called intestinal type of columnar epithelia. This is see, this where we see ये कहाँ मिलेगा आपको? This is something which we see in Barrett. And remember, Barrett esophagus in long term, Barrett will convert into adenocarcinoma. Barrett will convert into adenocarcinoma of stomach, of esophagus. Right? Barrett will convert into adenocarcinoma of esophagus. So this is something which you have to remember. Done? Okay, now just they ask you sometime question. This is like a brown color pigment. So first focus on this pigment. This brown color pigment is like, we also call this by different names. So you can call this lipofuscin. We can call this lipochrome. इसको lipochrome भी बोलते हैं. We also call this urochrome. Then remember this pigment, ये जो lipofuscin है, this pigment is also called as pigment of stress, or I can say pigment of aging, or pigment of wear and tear pigment. So understand this thing. So this is lipofuscin. So what we call this? We call this pigment of stress, pigment of I can say wear and tear. So ज़्यादा घिसने से भी हो जाता है, तो ज़्यादा घिसना नहीं है, ज़्यादा सोचने से, ज़्यादा स्ट्रेस लेने से, ज़्यादा परेशान हो से, ओवर थिंकिंग से. So I can give you a new name for this. It's pigment of overthinking. So ज़्यादा सोचने से, ज़्यादा ओवर स्ट्रेस करने से होता है लाइपोफुस्टिन. So understand this thing. The role of this pigment is slowly this pigment will accumulate, and what it will cause? It will cause a brown discoloration or brown atrophy of organ. So they ask you brown atrophy, brown atrophy of organ means brown atrophy of heart, brown atrophy of lung, brown atrophy of different organ. You will see with lipofuscin. So this is about lipofuscin, right? तुम पहले ये बताओ, तुम मेरा नाम रख के कौन हो? तुम मेरा नाम रख के बस कमेंट कर रहे हो यार, बताओ. Okay, coming to alizarin red and von Cosa. So you can see this red color is alizarin red and von Cosa. So these are the two stain. बताओ किसके लिए यूज करते हैं? बताओ. These two stains, alizarin red and von Cosa, these are the stain for. So these are used to stain calcium. So red one is alizarin red and black one is von Cosa. So these are stain. किसके लिए यूज करते हैं? Anyone? मदन, दक्ष, अन्ना, Ahmed Wali Sheikh. So yes, these are the for calcium. Sometime because of calcium accumulation, you can see these bodies are what we call them samoma bodies. अब इसको समझो. This is like an examiner favorite topic. These are nothing. These are rolled calcified bodies. So these are nothing. These are rolled calcified bodies. And where we see these bodies, understand these bodies are seen where? These are seen, so you can remember this by mnemonic most. Most means you will see them in meningioma, also in mesothelioma, also where? In mesothelioma. Then you can see this in ovary, in salivary gland, and in thyroid. Now understand, in तीनों के, in all these three you will see which cancer. In तीनों के कौन से cancer में मिलेगा? You will see this where? In papillary carcinoma. So papillary carcinoma of ovary, salivary gland, thyroid. This ovarian cancer, we also call this by another name. So remember, this ovarian cancer is also called as sometimes serous cyst adenoma of ovary. तो कभी कभी ऑप्शन में क्या देंगे आपको? serous cyst adenoma of ovary. So understand this thing. These samoma bodies, these are rolled calcified bodies, and they are made up of dystrophic calcification. So calcium यहाँ पर कौन सा होगा? Dystrophic. So these are made up of dystrophic calcification. So this is something which you have to remember related to samoma bodies. Done? Okay, now look at this. So this is what we call this aging. Aging means umr ka dalna. So they ask you like different questions on aging, like in exam. So क्या आपको याद रखना है? Just remember. So first thing is they ask you like what is the best method to prevent aging? Best to prevent aging. Aging prevent करने का बेस्ट तरीका क्या होगा? कम खाना. You need to eat less. That is calorie restrictions. So we need to restrict our calories. So calorie restriction is the best way. Now second thing what they ask you like this aging. Understand this thing. This aging can occur due to many reasons, but if you ask me like what is most common cause, so most common cause of like early aging, this is due to free radical injury. So patient will develop free radical injury. Now some people, they will look like much older than their usual age, right? So what we call this, much older than their usual age. So we call this premature aging, or we call this Werner syndrome. We call this Werner syndrome. So do not confuse Werner with Vermer. एक वर्मर भी होता है. वर्मर is a part of men syndrome. So Werner syndrome, understand, here patient will develop premature aging. Premature aging, we call this Werner syndrome. So understand, they ask you question like what is the name of enzyme which is defective here. So here we have defect in DNA helicase. So there is DNA helicase defect. There is DNA helicase defect. So this is about Werner syndrome. Am I clear? Then lastly, I can say this aging. Aging is mediated by a family of protein. So that protein is called sirtuins. So just remember, proteins which participate in aging process, this protein is called sirtuins. So actually this get mutated, right? So sirtuin, understand this thing. The sirtuin is something which get mutated. That's why we age. So sirtuin is protective. ओके, फिर आगे चलते हैं. दिस इज कीलॉइड, और कीलॉइड के साथ में क्या, हाइपरट्रॉफिक स्कार. तो पहले इसको समझो कैसे आप डिफरेंशिएट करोगे, राइट? हाउ वी कैन डिफरेंशिएट कीलॉइड फ्रॉम हाइपरट्रॉफिक स्कार, बताओ. सो कीलॉइड, अंडरस्टैंड समथिंग. फर्स्ट थिंग इज कीलॉइड कहीं भी हो सकता है. सो अंडरस्टैंड दिस थिंग, दिस कीलॉइड, दिस कैन अकर एनीवेयर. It can occur anywhere. Second important thing about keloid, understand this keloid is something which will cross wound margin. It will cross wound margin. Hypertrophic scar generally margin को cross नहीं करता. Then they ask you, we have different site. So most common site of keloid, most common site will be sternum, but कहीं भी हो सकता है, right? And in management of this, what we give intralesional. Intralesional means जो लीजन हुआ है, wherever we have keloid, वहीं पर आपको, right? Good evening, yes, नमस्कार हिमांशु. We give intralesional triamcinolone. We give intralesional triamcinolone. So this is about the keloid, right? Keloid. If you compare this with scar, if you compare this with scar, this is hypertrophic scar. So scar, understand, scar कहाँ पर होगा? This will occur at the injury site. So unlike keloid कहीं भी हो सकता है. Now understand this thing. Now coming, when you compare this, वहाँ पर मैंने आपको बताया था like keloid, if you see, keloid can cross margin. This is something which is, it will not cross. So this doesn't cross wound margin. So scar is nothing, it is basically a cosmetic problem. आप चाहो तो आजकल क्रीम आ गए हैं like Mederma, Hexilac, so those creams are available, anti-scar cream, or we can get remove this with LASIK therapy, right? So laser के through आप निकलवा सकते हो, हटा सकते हो उसको. So it is just a cosmetic problem. So again you can see this is hypertrophic scar, and this is what we say, we call this keloid. That आगे चले. Okay, now we have a question that they ask in exam where we see red infarct and where we see white infarct. So उसको समझते हैं एक बार, try to understand. So red infarct and white infarct. So understand, this is called white infarct, or we can call this pale infarct. So we call this white और pale. अब ये white और pale क्यों बोलते हैं? Understand this thing. So this is seen in those organ. ये उन organ में होगा जिनमें this those organ which have single blood supply. So what are these organs which have single blood supply? So this is seen where? Anyone? कौन बताएगा मुझे? Let me see. Where we see. And this here you can see what this is called. ये पूरा लाल दिख रहा है. This is called red infarct. So this is seen in those organs which have dual blood supply. Simple. बताओ अखून, शेख, अन्ना, हिमांशु, बताओ where we see red infarct, where we see white infarct. This white or pale infarct we see where? It is something that we see in heart, in spleen, and it is seen in kidney. Heart, spleen, kidney. And if you talk about this red infarct, so this is red infarct. This red infarct is something, it is seen in those organs which have dual blood supply. So understand, where we see red infarct, it is seen in LLB. LLB means it is seen in lungs. It is seen in lungs, liver, and it is seen in brain. LLB lung, liver, brain. दिख नहीं रहा ना यहाँ पर, तो कहीं और लिख देते हैं इसको. So just let me write it here. So that in fact you will see where? In lung, in liver, in brain. LLB. Done. पार्ट 3 भी आएगी, डोंट वरी. RDC सिंह पार्ट 3 आएगी. पार्ट 3 मेरे चैनल पे आएगी जनरली, मैं आपको मेरा अपने यूट्यूब चैनल पे आएगी, डोंट वरी. Okay, now coming to, you can notice this thing, this is like a scientist, Yoshinori Osumi. So अब इसको like purpose is not you to know this scientist, what you have to remember, आपको याद रखना है कि like this scientist, he did something and that's why he got a Nobel Prize. तो basically आप इसको समझो. So why he got Nobel Prize? This Nobel Prize was for autophagy. Autophagy का मतलब क्या होता है? Autophagy means cell start eating themselves. जब cell खुद को ही खा जाए. So when cell start eating themselves, what we call this? We call this autophagy. अब understand this thing, what they ask you in exam, like autophagy, where it is important, कहाँ पर इसका importance है. So understand this, we also call this like self cannibalism. So understand this thing, this autophagy is important where? In atrophy. So atrophy occur because of autophagy. अब आपसे एग्जाम में पूछते हैं like what is the marker for autophagy? So what is the marker for autophagy? So autophagy का marker हमारे पास होता है, that is called LC3, right? So this is about the autophagy which you have to remember. Now coming to blue, Prussian blue. So this is bluish blue color stain, Prussian blue. तो Prussian blue किसके लिए यूज़ करते हैं, कौन बताएगा? अनुज बताओ, ऋषभ, शौकेत. Prussian blue किसके लिए यूज़ करते हैं? Where we use Prussian blue? Anyone? Easy है. किसके लिए यूज़ करते हैं? Prussian blue is also called as pearl stain. Prussian blue also called as pearl stain. And this Prussian blue or pearl stain, understand this thing, this stain we use to see iron, or I can say precipitated form of iron. Iron का precipitated form को क्या बोलते हैं? We call this as hemosiderin. Precipitated form of iron is called as hemosiderin. So this is about Prussian blue. Done. Okay, so this is like you can see a black color stain. This black color stain is called as Sudan black. And this is a red color stain, we call this oil red O. Sudan black and oil red O. So understand this thing, this Sudan black and oil red O, these are two stains. These both stains. So these are used to stain fat or lipid. और फैट को स्टेन करने के लिए we have these two stain. Done. अब कैसे याद रखोगे? ऐसे याद रख लो कि लाइक गर्ल्स यूज लिपस्टिक, लड़कियां लिपस्टिक लगाती है तो उनके रेड लिप्स होते हैं, बॉयज सोटा पीते हैं तो ब्लैक लिप्स हो जाते हैं, सिंपल. So understand this thing. This is like lipid means lips. So you can see black lips, red lips, right? Okay, now coming to some cardinal signs of inflammation. So inflammation के क्या क्या main signs होते हैं? So what are these cardinal signs? Right. So let's understand this thing. कोई भी inflammation होगी तो उसके कुछ signs होंगे. So starting with first thing, you can see there will be heat, there will be redness, you can see swelling, pain होगा, and loss of function. So first four sign, heat, redness, swelling, pain, these four signs were given by a scientist. His name was Celsus. Celsus. So Celsus ने ये चार साइन दिए थे. These are four cardinal signs. And fifth sign, this fifth sign means loss of function. This was given by Virchow. So Virchow have given, these are total, I can say these are total 5 signs. So just let me do the labeling. So this is heat, redness, swelling, pain. So अगर मैं आपसे पूछूं what are these are called cardinal signs of inflammation. These are cardinal signs of inflammation. So first four signs were given by Celsus, and fifth sign fifth sign was given by Virchow. Then ओके. तो कभी कभी पेपर में ये फोटो आता है, इमेज बेस्ड क्वेश्चन अबाउट लाइक HIV स्ट्रक्चर. बेसिकली आपसे एग्जाम में क्या पूछते हैं, दे आस्क यू अबाउट दिस लाइक GP120 एंड दिस GP41. So these are the proteins. Sometimes they ask in exam. Done. Okay, now let's talk about Sjogren syndrome. What is Sjogren syndrome and what are the features you will notice in Sjogren syndrome? So just try to understand. First thing, in Sjogren syndrome there are a few features you can notice. ये जो पैरोटिड ग्लैंड के अंदर क्या है, you can notice lymphocytes are infiltrated. So first thing is it's an autoimmune condition. You will see lymphocyte infiltration. Lymphocyte infiltration into parotid gland. अब मैं आपको वो नहीं बता रहा हूँ कि ड्राई आइस, ड्राइनेस, वो सबको ऑलमोस्ट पता होता है. सो यू कैन नोटिस हियर वी हैव एंटीबॉडी. एंटीबॉडी कौन सी होगी? एंटी रो एंड एंटी ला. एंटी रो इज ऑल्सो कॉल्ड एस SSA. एंटी ला इज ऑल्सो कॉल्ड एस SSB. Anti-Ro, anti-La, SSA, SSB. Now understand, if you talk about Sjogren syndrome, so lymphocyte parotid gland में चले गए. So how we make a diagnosis? आपसे क्वेश्चन पूछते हैं कि इसका आप डायग्नोस कैसे करोगे? How we can make a diagnosis to this condition? So understand this thing. To make a diagnosis of Sjogren syndrome, we need to find these antibodies. और प्रॉब्लम क्या आती है? लाइक दिस इज लाइक पेशेंट विल हैव ड्राई स्किन, ड्राई माउथ, ड्राई वजाइना. So you can see dry eyes. Ultimately, there is a risk of blindness. There is a risk of blindness in Sjogren syndrome. What else you will have? You will see there is risk of blindness. There is risk of marginal zone lymphoma. There is risk of marginal zone lymphoma. Right? एंड हाउ वी गोइंग टू ट्रीट दिस कंडीशन? तो आपको सिम्टोमेटिक ट्रीटमेंट करना है. लाइक फॉर ड्राई आइज वी नीड टू गिव आर्टिफिशियल टीयर्स. आर्टिफिशियल टीयर्स ये किसके बने होते हैं? दीज आर मेड अप ऑफ कार्बोक्सी मिथाइल सेलुलोस. आर्टिफिशियल टीयर्स. देन फॉर ड्राई माउथ वी हैव अ ड्रग कॉल्ड सेवेमिलिन. अगर स्किन ड्राई हो गए तो यू कैन यूज सम मॉइस्चराइजर्स. देन अंडरस्टैंड दिस थिंग. फॉर आई कैन से लाइक ड्राई वजाइना वी कैन यूज लुब्रिकेंट. सम पीपल दे हैव वास्कुलाइटिस. तो वास्कुलाइटिस साथ में होती है. इन दैट केस वी नीड टू ऐड स्टीरॉइड्स. राइट. सो दिस इज अबाउट योर Sjogren syndrome. ओके. अब बताओ मुझे वेयर यू विल सी दिस. ये कहाँ मिलेगा आपको? ट्राई टू आंसर. where you will see this. Come on, Rishabh, बताओ. Rishabh, Anuj, RDC, Libman sac endocarditis. So you can see these vegetation. So this vegetation you will see these are present more on lower surface than upper surface. Second is ये जो vegetation बन रहे हैं यहाँ पर, these are sterile vegetation. Sterile vegetation, we also call this vegetation on valve pocket. इसको और क्या बोलते हैं? We call this vegetation on valve pockets, right? It is not infective, ऋषभ, infective नहीं है. Libman sac कहाँ होगा? Libman sac endocarditis you will see in SLE. Infective, in infective endocarditis you will notice, in infective endocarditis vegetations you will see where? On upper surface, right? This is your Libman sac endocarditis. So you will see vegetation on valve pockets and these vegetations are sterile. And अब देखो ध्यान से देख लो ये स्लाइड जो मैं लिख रहा हूँ यहाँ पर. दिस इज वन MCQ इन एग्जाम. दिस इज वन शॉर्ट क्वेश्चन इन एग्जाम दैट दे आस्क यू. ओके, नाउ लुक एट द स्क्रीन. देखो ध्यान से. फर्स्ट थिंग इज दे आस्क यू क्वेश्चन ऑन कैरियोटाइप. कैरियोटाइप मीन्स यू कैन सी 21 पे 2 की जगह 3 है. सो हियर व्हाट आई कैन से, दिस इज कॉल्ड ट्राइसोमी. So basically Down syndrome, just I am writing all the MCQs, you will notice here. You will notice first thing is trisomy 21. Second thing, remember this is most common genetic cause of mental retardation. इसके बाद second most common cause will be fragile X syndrome. Now understand, patient will have some classical feature, so you can notice here. This is like you can see a flat nose with upward slanting of eyes. Again उतना important नहीं है, but here you can notice a gap between toe and next finger. तो ज़्यादा gap आ गया. So what we call this? We call this as saddle toes. इसको बोलते हैं saddle toes. You can notice gap. Then next thing you will notice. Understand this thing. You can notice there is a single line. एक हाथ में केवल एक ये line है. This single palmar line is called as simian crease. We call this as simian crease. Single palmar line. What we call this? We call this simian crease. Now understand what are other MCQs. सब इसको समझो. So Down syndrome का patient है. So remember there are some cardiac defect here. तो कार्डिक डिफेक्ट जो आपको याद रखना है, मोस्ट कॉमन विल बी एंडोकार्डियल कुशन डिफेक्ट. देन इट कैन ऑल्सो कॉज VSD, ASD. पेशेंट विथ डाउन सिंड्रोम, अंडरस्टैंड डाउन सिंड्रोम का पेशेंट होगा. इन डाउन सिंड्रोम पेशेंट यू विल नोटिस लाइक देयर इज रिस्क ऑफ some GIT disease. Like there is risk of Hirschsprung disease. There is risk of Hirschsprung disease. There is risk of volvulus. There is risk of duodenal atresia. Ultimately in तीनों से you can notice there is risk of, ultimately कुछ भी हो गया, there is a chance patient can develop small intestinal obstruction. So there is chance of intestinal obstruction. I have seen a patient में मैंने देखा था एक बच्चे की डेथ भी इसी से हुई थी. Like all of a sudden he developed intestinal obstruction. Then remember there is risk of leukemia. So most common leukemia will be ALL. But अगर if child age is less than 3, शुरू के 3 साल, initial 3 year, there is risk of which leukemia? कौन बताएगा? AML. And which AML? Which AML? You will notice here M7 type of AML. M7 type of AML. So these are the MCQs that they ask on Down syndrome. Now compare this with Turner syndrome. अब इसको कंपेयर करते हैं टर्नर सिंड्रोम से. So how we can compare this with Turner syndrome? अब इसको देखो, look at the skin. In Turner syndrome you will notice like patient will have short height. So patient height is small, short height. Second thing, second thing you will notice, like there will be like a thick fat pad. You can notice a thick fat pad in the back, or what we call this neck is like having a fold of skin. एक skin का fold है जो गर्दन दिखेगी नहीं आपको, means face और I can say upper border of chest will be merged with each other. So what we call this is called like a webbed neck. Second important thing is here, this is webbing of neck. Now coming to third important thing, you will notice like patient will have a shielded chest, like a small breast, and there is a gap. जो nipples होंगे वो anterior line के पास जाएंगे. So you can see shielded chest and widely spaced nipple. Breast tissue small होगा और widely spaced nipples. Then you can notice like patient will have elbow deformity. We call this cubitus valgus. Cubitus valgus. Cubitus valgus. Then understand this thing. Patient will have like some pigmented spots. We call them nevi. Spots on nevi. पेशेंट को मेंसेस नहीं आएंगे और वी कॉल दिस नो मेंसेस और प्राइमरी एमेनोरिया. Primary amenorrhea, right? And you can notice like patient will have streak ovaries. So these are the features. Like now coming to, it is coarctation of aorta, not constriction. Coarctation of aorta. तो मैं इसको यहाँ लिख दे रहा हूँ. So they ask you what are the cardiac defect you will notice. So most common cardiac defect, बताओ कौन सा होगा. So most common cardiac defect is not coarctation of aorta. Anyone? कोई बताएगा? Coarctation of aorta is a classical cardiac defect, but most common will be bicuspid aortic valve. This is most common cardiac defect. Right? Yes, you will notice streak ovaries as well. So these are the features of Turner syndrome. You will notice. अगर मैं बात कर रही हूँ karyotype of Turner syndrome, so karyotype will be XO. XO means XO or X0. So there is no bar body. Bar body क्या होती है? Bar body means extra X chromosome other than one normal X chromosome. Now understand this thing. Karyotype is XY or XX. XY or XX. Right? IQ is low. याद रखना, very very important thing in Turner. In Turner IQ is normal. अगर मैं आपको बोलूँ टर्नर जैसे सारे फीचर्स, so other features are like Turner except cardiac defect. So remember, Turner जैसे ही क्या होगी, short height, there can be streak ovaries here also, there can be like small breast, but remember cardiac defect will be pulmonary stenosis. So this is called as Noonan syndrome. We call this as Noonan syndrome. So Noonan syndrome, understand, this is like we also call this male counterpart of Turner. ओके, अब कंपेयर देख लो, दोनों को कंपैरिजन देख लो. यू कैन नोटिस दिस इज अगेन कोऑक्टेशन. तो क्लाइन फिल्टर से कंपेयर कर लो. तो क्लाइन फिल्टर विल हैव पुअर बियर्ड ग्रोथ. कैरोटाइप विल बी XXY. देयर इज टॉल हाइट. देन यू कैन नोटिस IQ स्लाइटली इम्पेयर्ड एंड यू विल नोटिस पेशेंट विल हैव टेस्टिकुलर एट्रोफी. सो बेसिकली आपको जो याद रखना है, हियर विल हैव फीमेल लाइक फीचर्स. तो फीमेल लाइक स्किन, फीमेल जैसी स्किन टोन, फीमेल लाइक हेयर, फीमेल जैसे प्यूबिक हेयर, फीमेल जैसे लाइक मोर हेयर ऑन स्काल्प, एंड फीमेल लाइक सॉफ्ट स्किन, एंड फीमेल लाइक आई कैन से फीमेल लाइक हार्मोन भी है, फीमेल लाइक फैट डिस्ट्रीब्यूशन भी है. मीन्स लाइक इफ यू सी मेल हैव मोर फैट इन बेली, फीमेल दे हैव मोर फैट वेयर इन बटक्स एंड थाइस. तो इन मेल्स के भी फैट ज़्यादा कहाँ पर होगा, बटक्स एंड थाई. So this is your Klinefelter syndrome. Done. ओके, नाउ लुक एट द कैरियोटाइप। अब कैरियोटाइप को ध्यान से देखो, दिस इज एक्स पे सिर्फ एक ही है, सो व्हाट वी कॉल दिस टर्नर सिंड्रोम। यू कैन नोटिस, इसको बोलते हैं XO। XO क्लियर? आगे चलो। ओके, अब आपसे एग्जाम में क्वेश्चन पूछते हैं, दे आस्क यू क्वेश्चन ऑन लाइक माइटोकॉन्ड्रियल इनहेरिटेंस। तो देखो ध्यान से, दिस इज मदर। इफ मदर इज अफेक्टेड irrespective of gender, every baby will be affected। देखो, बेबी 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 बेबी, फादर से किसी को नहीं, अगेन मदर ऑल, फादर नो वन, मदर ऑल, फादर नो वन। सो आई कैन से this disease will follow all or none principle, means mother से it will affect all babies, and from father it will affect none. So from mother it will affect all, from father none. We call this mitochondrial inheritance. So मुझे बताओ, can you tell me example of mitochondrial inheritance? So what are the diseases which will have mitochondrial inheritance? Anyone? Rishabh, Anuj, हिमांशु, बताओ, what are the examples of mitochondrial inheritance? दो एक तो एग्जाम्पल बताओ तो, which are important. कहाँ गायब हो गए सब? एनीवन? व्हाट आर द एग्जाम्पल्स? बहुत ईजी है, बस नाम बड़े बड़े। सो व्हाट आर द डिसीजेस विच वी हैव हियर? मेलास, माइटोकॉन्ड्रियल एनसेफेलोपैथी, लैक्टिक एसिडोसिस, स्ट्रोक। देन लेबर हेरिडिटरी ऑप्टिक न्यूरोपैथी, LHON, न्यूराइटिस, अटेक्सिया, रेटिनाइटिस पिगमेंटोसा, राइट? क्रोनिक progressive external ophthalmoplegia, CPEO. So these are the example which you have to remember. और अगर सब कुछ भूल जाओ, just remember this only very very important one is this one, melas. Done? Okay, now coming to some systemic part. थोड़े से systemic part की बातें कर लेते हैं. This is aphthous ulcers, means मुंह के छाले. So remember these ulcers are benign एंड पेनफुल। ये अल्सर्स बेनाइन होंगे और पेनफुल होंगे, बट रिमेंबर, तो दे कैन अकर एनीवेयर। सो बेसिकली दीज आर द अल्सर्स विच विल हैव लाइक आई कैन से अ वाइटिश अल्सर्स विद अ ग्रे बॉर्डर। दर्द होता है, लेकिन होते क्यों? बिकॉज ऑफ GI अपसेट और स्ट्रेस। सो बेसिकली इट अकर रीजन फॉर दीज अल्सर विल बी इट अकर ड्यू टू GI अपसेट, तो या तो पेट खराब है या दिमाग खराब है, और स्ट्रेस। तो दीज आर द रीज़न फॉर दीज अल्सर्स। ओके, अब देखो ये क्वेश्चन आपके एग्जाम में बार बार पूछा है, पैपनिमर बॉडीज। तो आपको मुझे बताना है वेयर यू विल सी पैपनिमर बॉडीज। एनीवन हु विल टेल मी दिस, वेयर वी सी, वेयर यू विल सी पैपनिमर बॉडीज, बताओ। So papanimer bodies, understand this thing, these are the bodies which we see in a patient with sideroblastic anemia. Many times this question came in exam, कई बार आ चुका है। So papanimer bodies you will see in a patient with sideroblastic anemia, right? So basically these are iron containing bodies, we call this papanimer bodies. Howell Jolly bodies. So what are Howell Jolly bodies? You can see इसके अंदर एक ब्लू कलर का दिख रहा है कुछ, so this is called like a nucleus remnant. So Howell Jolly body is nothing, it is a nucleus remnant. It is a nucleus remnant. And where we see this, कहाँ मिलेगी Howell Jolly bodies? Where we see Howell Jolly bodies? So understand this thing, Howell Jolly body you will see in any patient who don't have spleen. एस्प्लीनिया, एस्प्लीनिया मीन्स जिस पेशेंट का स्प्लीन निकल चुका है, एनी पेशेंट हु डोंट हैव स्प्लीन, और आई कैन से ड्यू टू स्प्लीन रिमूवल। सो पोस्ट स्प्लेनेक्टोमी, दिस इज समथिंग विच वी सी पोस्ट स्प्लेनेक्टोमी, हॉवल जॉली बॉडीज। इससे मिलती जुलती होती हाइंस बॉडीज, बट रिमेंबर हाइंस बॉडीज these are like precipitated or denatured hemoglobin. Done? So let's see, these are called sickle cells. Sickle cells means RBC का शेप। हसिया, पता हसिया आता है एक जो काटने के लिए, घास काटने के लिए, अचार काटने के लिए जो बनाते हैं, This is called sickle cells. So sickle cells, or we call them trypanocyte. Sickle cells, or we call them trypanocytes. So these are sickled RBCs, and these sickled RBCs, where we see them in sickle cell anemia. These are seen in sickle cell anemia. Done. Okay, now look at the screen. We have teardrop cells. Teardrop cells means RBCs, they will look like a drop of tear. Teardrop cells. These teardrop cells, understand, these are seen in a patient with thalassemia. Thalassemia. And remember, where else we see them? और कहीं मिलेगा, कोई बताएगा? Anyone? Where else we see them? और कहाँ मिलते हैं? Come on. Where else we see them? They are seen where else? In myelofibrosis. Whenever there is a fibrosis in bone marrow, so in myelofibrosis. Okay, so this is called rouleau formation. Rouleau formation, or I can say RBCs will arrange them like a stack of coin appearance. Stack of coin appearance, or what we call them? We call them rouleau formation. And where we see this where? In a patient with multiple myeloma. So stack of coin appearance or rouleau formation you will see in a patient with multiple myeloma. Then you can notice this is called chipmunk face. Chipmunk face means now face of the child will look like a chimpanzee or a monkey. This chipmunk face, understand, this is due to extramedullary hematopoiesis, and this is classically seen in thalassemia. It is classically seen in thalassemia, and sometimes you will see this in sickle cell anemia. अगर दोनों में से एक चुनना है, if you have to choose one, then choose thalassemia. Then moving to next, this is smudge cells. Smudge cells. So you can notice the smudge cells. These are the classical feature of chronic lymphoblastic leukemia, CLL. Hypersegmented neutrophils. So if you see 1, 2, 3, 4, 5, 6, यहाँ पर अगर आप काउंट करोगे, if you count here 1, 2, 3, 4, 5, 6, 7. So whenever your neutrophil will have more than 5 segment, if neutrophil is having more than 5 segment, such neutrophil is called as hypersegmented neutrophil. And this hypersegmented neutrophil, understand, it is seen where? It is seen like in a patient with B12 deficiency and folic acid deficiency. You will see this in a patient with B12 deficiency and B9 deficiency. Hypersegmented neutrophils. Okay, now look on this. These are oil rods. Oil rods means ऐसी rod मिलती हैं आपको. These are like you can see intracytoplasmic rod like structure, and these rods are classically seen in AML. So AML के कई सारे type होते हैं, like from M0 to M1, M2, M3, M4, M5, M6, M7. So maximum oil rods you will see where? In M3 AML. So M3 will have maximum oil rods. Done? Okay, now look at this. This is like a starry sky pattern. These are like tingible body macrophages. These starry sky appearance you will see in Burkitt lymphoma. So starry sky pattern कहाँ मिलता है आपको? In Burkitt lymphoma. Then these are lytic bone lesion, or I can say like we call them punched out lesion. Punched out lesion, or we call them as lytic bone lesion. punched out lesion or lytic bone lesion. So this is something which we see in multiple myeloma. Punched out lesion or lytic bone lesion, where we see in multiple myeloma. Okay, now coming to red neurons, these are red color neurons. So just understand this thing, these red neurons are classical feature. Red neurons कहाँ मिलेंगे आपको, where we see red neurons? So red neurons, understand, these are seen. I can say this is one of the earliest change after infarct. This is earliest change post brain stroke. ब्रेन में स्ट्रोक के बाद सबसे पहले क्या चेंज होगा? रेड न्यूरॉन्स. एंड अल्टीमेटली लास्ट में क्या होगा? एट लास्ट यू विल नोटिस देयर विल बी लाइक हीलिंग विथ ग्लायोसिस. Okay, then focus on this. These are, you can notice like atrophy of cortex. So you can notice like a cerebral or cortical atrophy. Then you can notice these are like a plague, neuritic plague. We call them neuritic plague. And these are triangular structures. These triangular structures are called neurofibrillary tangles. Neurofibrillary tangle. Neurofibrillary tangle. So these are the changes which we see in a patient with Alzheimer's disease. In a patient with Alzheimer's disease, right? Just remember we have a protein. इस प्रोटीन का नाम होता है टाउ प्रोटीन. टाउ प्रोटीन के आसपास फॉस्फेट ग्रुप होता है. वी कॉल दिस हाइपर फॉस्फोरिलेटेड टाउ प्रोटीन. This hyper phosphorylated tau protein will form these nachos like structure. We call them as neurofibrillary tangles. And remember, these tangles are directly proportional to severity. जितने ज़्यादा tangles उतनी severe disease, right? So tangles are directly proportional to severity. Okay, now let's talk about a condition called Parkinson disease. So Parkinson को समझो, what type of question they ask you in exam. So you can notice this is like a person who is having a pallor of substantia nigra. देखो normal substantia nigra ऐसा, nigra means black, it will look black in color. So here you can see pallor, or you can say depigmentation or loss of pigment. Then in Parkinson you can find these Levy bodies. These Levy bodies, understand, these Levy bodies, these are made up of alpha synuclein protein. Levy body, these are made up of alpha synuclein protein. So Levy body you will find in two places. It is seen in Parkinson disease, and there is one more condition, dementia with Levy body. So understand this thing, substantia nigra, pallor and Levy bodies you will see in a patient of Parkinson disease. Right? Yes, we have a clinical triad. Clinical triad को बोलते हैं tremors, rigidity, akinesia and postural instability. So triad, what we have, we call this tremor, rigidity, akinesia and postural instability. So this is like, these are the triads, these are like feature. Triads क्या हो गया? तीन चीज़ें हो गई. In triad we have three conditions, but these four are classical or cardinal symptoms. Okay, now focus on this. This is Huntington disease. So Huntington disease आप ऐसे याद रख लो, hunt for cage. Hunt for cage means, hunt means Huntington. Hunt means Huntington. 4 means chromosome number. So chromosome is 4. Cage means CAG repeat. Cage means CAG repeat. So hunt for cage. Hunt for cage. Right. So Huntington disease chromosome 4 and you will see CAG repeat. CAG repeat. ओके नाउ अंडरस्टैंड. देखो पहले इसको ट्रीट करने के लिए ड्रग नहीं था, बट नाउ वी हैव टू वेरी गुड ड्रग फॉर दिस कंडीशन. इट इज टेट्राबेनाजिन, tetrabenazine and deutetrabenazine. Deutetrabenazine. So tetrabenazine and deutetrabenazine, these are two new drugs which we have for Huntington disease. Spongiform encephalopathy. Spongiform encephalopathy, you can see nucleus, you can see the cells, brain cells, they will look like a sponge. So it is nothing we see where in Creutzfeldt-Jakob disease. And Creutzfeldt-Jakob disease is what? It is a prion disease. अब प्रायन क्या होते हैं? प्रायन्स आर नेदर बैक्टीरिया नॉर वायरस, दीज आर इन्फेक्शियस प्रोटीन. सो CJD में क्या होता है? PRPC. PRPC is a protein and this protein will convert into PRPSC. PRPSC. Now understand, if you talk about like CJD, Creutzfeldt-Jakob disease, what you will notice like here in 6 months there will be loss of all memory. 6 महीने में पेशेंट की सारी मेमोरी गायब हो जाएगी और 1 साल में डेथ हो जाएगी. So they ask you like most, or I can say rapid progressive dementia. Rapid progressive dementia. Rapid progressive dementia you will see where? In Creutzfeldt-Jakob disease. In Creutzfeldt-Jakob disease you will see most rapid progressive dementia. Okay, now coming to this thing, you can notice this is like samoma bodies and you will notice meningioma. So meningioma is a brain tumor. Then you can notice oligodendroglioma. Then this is PCA, pilocytic astrocytoma. PCA, understand, this is like a cystic nodule. So this is PCA is something which is most common primary brain tumor in children. In PCA, in biopsy में क्या मिलेंगे? You will find these red color fibers. We call them Rosenthal fibers. Rosenthal fibers. So this is called a butterfly tumor. Butterfly tumor means you can notice tumor will spread from one hemisphere to another hemisphere. We call this glioblastoma multiforme. तो एक बार मैं आपको बता दे रहा हूँ कि आपको क्या क्या याद रखना है ब्रेन ट्यूमर में. सो ग्लायोब्लास्टोमा मल्टीफॉर्मे, रिमेंबर वी ऑल्सो कॉल दिस बटरफ्लाई ट्यूमर. Butterfly tumor. And biopsy, in this biopsy you will find two important bodies. कौन कौन सी bodies थी? We have pseudo palisading body. Pseudo palisading body and glomeruloid body. Glomeruloid body. Pseudo palisading body and glomeruloid body. Now understand ependymoma, what you have to remember, this tumor will have drop metastasis. Drop metastasis. Then these like Rosenthal fibers, cystic nodules. So these are all seen where? These are all seen in astrocytoma. And PCA is nothing. PCA is a type of astrocytoma. Now coming to oligodendroglioma, remember it occurred due to IDH1 mutation. So here basically you will find fried egg appearance and chicken wire pattern. Fried egg and chicken wire pattern. So we also call this as non-veg tumor. Fried egg appearance, chicken wire pattern. So these are the MCQ which they ask on brain tumors. Okay, now coming to a physicist machine. सो अंडरस्टैंड व्हाट इज़ द पर्पस ऑफ दिस मशीन, कौन बताएगा क्या पर्पस होता है फ्रेश मशीन का? ऋषभ, अनुज बताओ, वाई वी यूज़ दिस मशीन? एनीवन, एनीवन? एनीवन? कोई तो बताओ. So this is like a machine which is used to extract platelets, right? This is like a machine which will separate blood and from blood you will get various components. Like basically understand, this is a machine which is used to give us platelets, right? समझ आया? तो उसको देखो पहले लाइक वी विल डू लाइक इट्स अ मल्टी स्टेप प्रोसेस. वी विल यूज फर्स्ट हाई फ्लो सेंट्रीफ्यूगेशन, देन वी विल डू लो फ्लो सेंट्रीफ्यूगेशन, अल्टीमेटली वी विल एक्सट्रैक्ट डिफरेंट ब्लड एंड देयर प्रोडक्ट, राइट? तो बेसिकली इससे आपको प्लेटलेट मिलते हैं एंड वी गेट अदर ब्लड प्रोडक्ट, अदर blood product. So these were some of the image based revision, right? So now just take a short break. After break we'll discuss the detail and the aspects कि आपको बड़ा clinical question कैसे solve करना है path का, right? So we will have like a few more slides. So come back in 10 minutes. Then we'll discuss what are other things which they ask in exam, right? How to approach different clinical questions or some bigger question in pathology, right? Okay, so come back in 10 minutes. Okay guys, so let's now talk about a different type of cellular adaptation. Am I audible? Audio video is fine. So just try to understand कैसे कैसे क्वेश्चन आते हैं आपके एग्जाम में. So that is something which is important. So they ask you question on different adaptation. So आपसे क्वेश्चन adaptation का पूछते हैं. So what we have in adaptation, we have hypertrophy, atrophy, then we have hyperplasia, metaplasia, right? So understand this thing. Hypertrophy, atrophy, hyperplasia, metaplasia. So first try to understand, they ask you like what are the definitions. So definition means hypertrophy means increase in size, right? Size बढ़ रहा है. Now they ask you like what are the examples of hypertrophy. तो पहले definition देख लेते हैं. Atrophy means decrease in size. Hyperplasia means increase in number. Metaplasia means change in epithelia, means epithelia is changed. So these are the definitions. तो पहले तो बात करें definitions की. Now second thing what they ask you in exam, they ask you like where we see, कहाँ दिखता है. So understand this thing, hypertrophy, it can be physiological, it can be pathological. So you can see this where in bodybuilding, in gymming. तो जिम से क्या होती है, मसल की हाइपरट्रॉफी. Then you can see hypertrophy where in breast tissue. You can see hypertrophy where in pregnant uterus. But what are the pathological example? It is left ventricular hypertrophy, it is right ventricular hypertrophy. So this is about the hypertrophy. अगर मैं आपसे पूछूं नेक्स्ट वन इज हाइपोट्रॉफी और एट्रॉफी, तो एट्रॉफी कहाँ मिलेगी? वेयर वी सी एट्रॉफी, बताओ एट्रॉफी कहाँ मिलती है? वेयर वी सी एट्रॉफी, you can see atrophy where in the cortex. So we see cortical atrophy. तो मैं यहाँ पर सिर्फ इम्पॉर्टेंट वाले लिख रहा हूँ. You can see atrophy in malnutrition disease like kwashiorkor marasmus. You can see atrophy in like a patient who is suffering from cancer or some terminal illness like cachexia, right? Then atrophy you can see like in a person. The malnutrition means two diseases, kwashiorkor and marasmus. kwashiorkor and marasmus. और कहीं पे atrophy होगी anyone? Anywhere else you will see atrophy? Like suppose if you will not use any organ, we call this, उसको क्या बोलते हैं? Disuse atrophy. Disuse atrophy. So these are the example of atrophy. Now coming to hyperplasia. So hyperplasia where we see hyperplasia also you will see in breast and uterus. Then hyperplasia you can see in BPH, benign prostate hyperplasia. Hyperplasia you can see like in a patient, I can say in a patient who is suffering from endometrial hyperplasia. Endometrial hyperplasia. Then you can see hyperplasia even like in a patient who is having liver transplant. So liver transplant में जो hyperplasia होगा, that is I can say in a patient with liver transplant, इसको बोलते हैं compensatory hyperplasia. Coming to metaplasia, understand most common cause, I told you metaplasia का most common cause was smoker's lung. Then metaplasia you can see where in Barrett. And third important example of metaplasia जो आपको याद रखना है, this third important example of metaplasia is myositis ossificans. Myositis ossificans. Myositis ossificans. So this is like a simple, short and sweet slide where you can see like all the different types of adaptation. Done? Am I clear? Okay, आगे चलते हैं. Now they ask you question on free radical injury. तो आपसे क्वेश्चन पूछते हैं free radical injury. So we have different types of free radical. कौन कौन से free radical होते हैं? पहले तो मुझे बताओ what are the types of free radical you know. So first try to understand this free radical injury को समझने के लिए जैसे member we have oxygen. This oxygen will generate superoxide ion. It will generate superoxide ion. The superoxide ion will now convert into H2O2. H2O2 means hydrogen peroxide. And now this peroxide, understand, this peroxide will convert into hydroxyl free radical. It will convert into hypochlorous acid, HOCl. अब इसको देखो, अगर मैं आपको थोड़ा सा इसको ब्रीफ करके दिखाऊं. सो फर्स्ट एंजाइम ऑक्सीजन विल कन्वर्ट इनटू सुपर ऑक्साइड. दिस इज कॉल्ड सुपर ऑक्साइड. दिस इज कॉल्ड peroxide and this is called hypochlorous acid. Hypochlorous acid. So now try to understand this thing. अब इसको समझो थोड़ा सा. This HOCl, we can write it like this. It will further produce OH free radical. So इसको अगर आप OH अलग लिख दोगे, Cl अलग दोगे, we get OH. OH means it is called hydroxyl free radical. We call this hydroxyl free radical. And similarly, understand here there is like iron Fe2 plus. This Fe2 plus will convert into Fe3 plus. And similarly, when this Fe3 plus this Fe3 plus is converting back into Fe2 plus. So you can see Fe2 plus and Fe3 plus, they keep on converting into each other. So they also use oxygen as a free radical. So this reaction is what we call this as Fenton's reaction. So now try to understand what type of question they ask you in exam. They ask you question like most dangerous free radical. Most dangerous free radical will be hydroxyl free radical. Now let's label the names of enzyme. So first enzyme, try to understand. When oxygen is converting into superoxide ion, इसको बोलते हैं, this is like NADPH oxidase. We call this as NADPH oxidase. Superoxide जब convert होगा, we call this superoxide dismutase. Superoxide. And H2O2 when it convert into HOCl, we call this MPO, means myeloperoxidase. So this is about your free radical. Now they ask you like these free radicals are important for aging process, and how we can prevent. We can prevent this by antioxidant. So understand this thing. अगर मैं आपसे पूछूं what are antioxidants, so it could be like I can say vitamins, it could be minerals, it could be, I can say, and it can be enzymes. So what are the vitamins which act as antioxidants? So remember, vitamins which act as antioxidant, these are vitamin A, C and E. So vitamin A, C, E. So these are the vitamins which act as antioxidant. Done. So this is something which you should know about antioxidants and free radicals. Done. ओके, अब एक बार देखो नेक्रोसिस से क्वेश्चन को आपको कैसे सॉल्व करना है. व्हाट टाइप ऑफ क्वेश्चन दे आस्क यू फ्रॉम नेक्रोसिस. सो मैंने आपको लाइक आई टोल्ड यू वेरियस टाइप्स ऑफ नेक्रोसिस. सो जस्ट ट्राई टू अंडरस्टैंड. अगर मैं आपको ये सारी नेक्रोसिस समराइज कर दूं, सो आई टोल्ड यू कोएगुलेटिव नेक्रोसिस, देन वी हैव डिस्कस्ड अबाउट लिक्विफैक्टिव नेक्रोसिस. Third necrosis I told you about fat necrosis. Fourth one will be caseous necrosis. Fifth will be fibrinoid necrosis. and sixth will be gangrene. Or gangrenous necrosis. So these are the total 6 types of necrosis. So first let's talk about the mechanism of coagulative necrosis. So this coagulative is due to protein denaturation. It occurred due to protein denaturation. Liquefactive, this occurred due to enzymatic degradation. So mechanism क्या हो रहा है? Enzymatic. Fat necrosis, it occurred due to a process. इस process को बोलते हैं saponification. Caseous is a combination of coagulative and liquefactive. Fibrinoid is due to immune complex. And gangrene again you will see like it is like again coagulative and liquefactive दोनों तरीके का होगा यहाँ पर भी. It is coagulative or liquefactive. So these are the reason. Now they ask you a question कि where you will see each and every type of gangrene आपको कहाँ मिलता है or you can notice. So if you see coagulative, if you see liquefactive, so gangrene में अगर liquefactive necrosis ज़्यादा है we call this as wet gangrene. Coagulative ज़्यादा है what we call this? We call this as dry gangrene. Now coming to fibrinoid necrosis, it is due to immune complex. It is due to immune complex. And always remember this immune complex is which type of hypersensitivity? Type 3. Caseous you will see where? Caseous you will see where? You will see caseous necrosis in TB and sarcoidosis. Just ये दो आप याद रखो. And some systemic fungal infection as well. Systemic fungal infection. Okay, बात करते हैं fat necrosis की. So fat necrosis, understand here you will see saponification. So here you can notice like micelle formation. You can notice here micelle formation. If you talk about liquefactive, इसका जो दूसरा नाम होता है वो आपको याद रखना है. We call this as collicuative necrosis. And coagulative, this is most common type. Most common, or I can say we also call this parent necrosis. इसको और क्या बोलते हैं? Parent necrosis. Parent necrosis. Then you can notice few more feature in coagulative. You will notice tombstone pattern. Tombstone pattern. And you can notice ghost body. You can notice ghost body. And finally the last thing which they ask you in exam is where you will see these necrosis. तो सारे necrosis को हम summarize कर लेते हैं. So where we see these necrosis, so understand this thing. If you ask me gangrene, you will see the classical condition that is causing gangrene will be diabetes. अगर मैं आपको बोलूँ fibrinoid में क्या याद रखना है, what you have to remember in fibrinoid, you have to remember is malignant hypertension, pan and rheumatic fever. Caseous का हमने ऊपर लिख लिया था. This is something which you have to remember in caseous. And remember the necrosis pattern will be cheese like. Fat necrosis you will see where? In breast, omentum and peripancreatic fatty area. Peripancreatic area. Suppose अगर मैं बात करूँ आपको liquefactive, तो liquefactive you will see in brain, in abscess and in the pancreas. Coagulative you will see everywhere because this is the parent necrosis and it is classically seen in heart. So these are, देख लो अब आप किसी भी बुक उठा के देख लो, you will notice like necrosis के बारे में सब जगह इतने दिए हैं. So this is the summary of different types of necrosis. Done. This is the summary of different types of necrosis which you have to remember. Am I clear? Okay, now coming to apoptosis. So what are the MCQs they ask on apoptosis? So apoptosis, understand. So we have different pathways of apoptosis. Apoptosis can be physiological, it can be pathological. So physiological example of apoptosis, it is organogenesis, menstrual cycle, involution of thymus, involution of thymus at puberty. पैथोलॉजिकल एग्जाम्पल की अगर मैं बात करूँ, सो वी हैव councilman bodies, these are apoptotic bodies, right? These are apoptotic bodies, councilman bodies. Okay, now understand this thing. If you talk about what else they ask you, the most important enzyme in apoptosis, it will be caspase. Then try to understand. Sometimes like they ask you different types of question in exam. What is the hallmark feature? So what is the hallmark feature of apoptosis? It is like you can notice chromatin condensation. और क्या आपसे पूछते हैं एग्जाम में, एपोप्टोसिस में कौन सी टाइप की इन्फ्लेमेशन होती है? व्हाट टाइप ऑफ इन्फ्लेमेशन यू विल सी इन एपोप्टोसिस? सो रिमेंबर, देयर इज नो इन्फ्लेमेशन in apoptosis. You will see no inflammation and there is no damage to membrane. There is no inflammation and there is no damage to membrane. कोई inflammation नहीं होती. And lastly I can say like what stain we have for apoptosis. So stain जो use करते हैं, that is called annexin V. Annexin A is for hairy cell leukemia. Here we have annexin V. Okay, now understand they ask you a question on like what are the various pro-apoptotic gene and what we have anti-apoptotic gene. Pro-apoptotic gene, anti-apoptotic gene. अब इसको ध्यान से देखो. I told you like all the anti-apoptotic gene they will end in L. इनके end में L होगा. So we have BCL2, BCL1, MCL, BCLXL, right? So ये आपको याद रखना है. Then try to understand. They ask you what are pro. So pro कई सारे होते हैं. So we have P53, Puma, BID, BIN, BIM, BAK, BAS, done. BAD and remember BCL XS. तो मैंने आपको बताया था प्यूमा के शूज़ आते हैं. डेनिम मीन्स DNM, डेनिम जीन्स. दीज आर बकवास एंड बैड. सो प्रो एंड एंटीप्रोटिक जीन. क्लियर? Okay, now understand. What else they ask you? They ask you sometime question like we have already discussed about lipofuscin. So lipofuscin मैंने आपको बताया था, it is like wear and tear pigment. So इसको तो हमने डिटेल में डिस्कशन कर लिया था. We also call this wear and tear pigment or pigment of aging, or it's also called as pigment of aging. Wear and tear pigment or pigment of aging. Done. Okay, then they ask you question on calcification. अब आपसे क्वेश्चन पूछते हैं कैल्सिफिकेशन में. कहाँ गए सब लोग? Where we see calcification, which type of calcification where we see? So calcification, understand, we have two types of calcification. We have dystrophic and what else we have? We have metastatic. Dystrophic calcification and metastatic calcification. So understand this thing. Dystrophic calcification में सीरम कैल्शियम कैसा होगा? Serum calcium, this will be normal. Why? Because it is seen in dead tissue. In metastatic calcification, serum calcium will increase. मेटास्टैटिक में सीरम कैल्शियम ज़्यादा होगा, एंड दिस इज समथिंग विच वी सी इन लाइव टिश्यू. It is something which we see in live tissue, and most common live tissue it will be lung. अब आपसे क्वेश्चन क्या पूछते हैं, दे आस्क यू लाइक वेयर यू विल सी डिस्ट्रॉफिक कैल्सिफिकेशन, वेयर यू विल सी मेटास्टैटिक. सो डिस्ट्रॉफिक कैल्सिफिकेशन आप याद रख लो, मैंने आपको एक निमोनिक भी बताया था, दैट इज रात मोस्ट फॉर पीजी, रात मोस्ट फॉर पीजी इन मेडिसिन, रात मोस्ट for PG in medicine. So RAT means rheumatic fever, A for atherosclerosis, T for TB of lymph nodes, M for meningioma, M for mesothelioma, O for ovarian cancer, S for salivary gland, T for thyroid. और इन तीनों के किस में you will notice where in papillary cancer of all these three. P for prolactinoma, G for glucagonoma, and M is a rare condition called Monckeberg medial sclerosis. So these are the examples, ध्यान से देखो, these are the examples of dystrophic calcification. Now coming to metastatic. अब metastatic कहाँ मिलेगा, where we see metastatic? So understand, metastatic you will see in a patient with हाइपरपैराथायरॉयडिज्म, मैंने शॉर्ट में लिख दिया PTH. जब PTH बढ़ेगा, सो अंडरस्टैंड, इट कैन बी सीन इन हाइपरपैराथायरॉयडिज्म, देन यू कैन नोटिस दिस वेयर PTH कब बढ़ेगा. इट कुड बी लाइक प्राइमरी और सेकेंडरी. सो लाइक प्राइमरी इट कुड बी ड्यू टू, आई कैन से प्राइमरी इट कुड बी ड्यू टू पैराथायरॉयड एडिनोमा, और इट कुड बी सेकेंडरी ड्यू टू CKD patient. So then understand, this can occur in multiple myeloma. Then you can notice this hyperparathyroidism, or you can notice this metastatic calcification. You can see this in Paget's disease. Then there is a condition called sarcoidosis, and the last and the important one is milk alkali syndrome. So these are the example of मेटास्टैटिक कैल्सिफिकेशन. ओके, अब इसको देखो, आपसे क्वेश्चन एग्जाम में पूछते हैं इन्फ्लेमेशन की स्टेप्स. सो दे आस्क यू क्वेश्चन ऑन व्हाट आर द वेरियस स्टेप्स ऑफ इन्फ्लेमेशन. सो स्टेप्स स्पेशली विच स्टेप्स, स्पेशली दो स्टेप्स लाइक जब आपका लाइक व्हेन योर सेल्स आर मूविंग, वी कॉल दिस सेलुलर इवेंट. सो व्हाट आर द सेलुलर इवेंट विच दे आस्क इन एग्जाम. सो रिमेंबर वी हैव मार्जिनेशन, rolling, adhesion, transmigration. Transmigration is also called as diapedesis. Chemotaxis, opsonization, and phagocytosis. So these are the steps: margination, rolling, adhesion. तो पहले तो आपको ये स्टेप्स का सीक्वेंस भी पढ़ना है. यू नीड टू रिमेंबर द सीक्वेंस ऑफ दीज स्टेप्स. अब इसको देखो, सो सीक्वेंस कैसे याद रखना है. मिस्टर राम alone took care of people. Now understand. अब आपसे क्वेश्चन क्या पूछते हैं, दे आस्क यू व्हाट आर द केमिकल्स विच हेल्प इन दीज ईच ऑफ दीज इवेंट्स. So margination is nothing, it is movement from center to periphery, so nobody is helping here. Rolling is done with the help of a protein, and these proteins are called selectins. So we have E-selectin, we have P-selectin and L-selectin. So EPL, these are types of selectin. Now coming to adhesion. Adhesion is done with the help of a protein, and these proteins are called integrins. Integrins and CAM. CAM meaning is cell adhesion molecules. Transmigration, understand. In transmigration what we have? We have PCAM. In transmigration we have PCAM. PCAM क्या होता है? Anyone? In transmigration we have PCAM. PCAM का CD marker कौन बताएगा मुझे? Anyone? So what are the CD marker for this? CD31. कौन सा था CD बताओ? Yes, CD31. Coming to chemotaxis. VCAM, ICAM, these are types of CAM. Chemotaxis, understand? Chemotaxis is done with the help of LIC. So what is LIC? LIC means leukotrienes B4, interleukin 8 and C5a. And last one is opsonization. Second last is opsonization, means we have, this is done with the help of opsonins. अब opsonins क्या होते हैं? So these are nothing, these are the proteins, or these are the molecules. So we have FC portion of IgG. C-reactive protein, C3b and fibrinogen. So these are the four things which are acting as opsonins. And finally what we have phagocytosis, that is killing and degradation. So phagocytosis means killing. So बाप से ध्यान से देख लो, again a second slide. This is very very important, one MCQ in exam. एक क्वेश्चन यहाँ से पूछते हैं. They ask you one question in exam. Done? Okay, then we have different mediators. कई सारे mediators होते हैं. In cells we have different types of mediators, like some mediators, understand, these mediators can be like in the cells, so we call them cellular mediators. हो सकता है like these mediators are in the cells. So these are called cellular mediators. Or sometime I can say these mediators, they are in the plasma. ये plasma में होते हैं, right? These are in the plasma. Am I clear? So understand this thing. This mediator can be in the cells, in the plasma. अब cells में कौन कौन से होते हैं? Anyone? What are the mediators in the plasma and the cells? So in the cells what we have? We have histamine. We have histamine, right? Then understand what else we have. और कौन से होंगे? Anyone? और कोई से? Anyone you know? और कोई बताओ, इजी है तो बहुत. हिस्टामिन, सेरोटोनिन, राइट. देन वी हैव नाइट्रिक ऑक्साइड. यस, नाइट्रिक ऑक्साइड. व्हाट एल्स? अराकिडोनिक एसिड मेटाबोलाइट. अराकिडोनिक एसिड मेटाबोलाइट इन द प्लाज्मा. इन द प्लाज्मा व्हाट वी हैव? प्लाज्मा में हमारे पास कुछ सिस्टम होते हैं. सो वी हैव बेसिकली 3 सिस्टम. वी हैव काइनेन सिस्टम, देन वी हैव कॉम्प्लीमेंट system, and we have coagulation system. So these are in the plasma. So we have in the cells, in the plasma. Done? Okay, coming to chronic granulomatous inflammation. When you will call this chronic granulomatous inflammation, so जहाँ पर भी ग्रैनुलोमा बनेगा उसको हम बोलते हैं chronic granulomatous inflammation. So where we see granuloma formation? You can see this where? In TB. You can see this in sarcoidosis. You can see this where? In leprosy. Then in Crohn's disease. Granuloma you will notice where in a patient, like you can notice CNS malaria, toxoplasmosis, cat scratch disease, Q fever, Q fever, berylliosis. So these are example of granulomatous inflammation. These are the examples of granulomatous inflammation. Done. So these are those inflammation where we'll have formation of granuloma. अब देखो ग्रैनुलोमा होता क्या है. ग्रैनुलोमा, अंडरस्टैंड, दिस इज लाइक प्रोडक्ट विच इज मेड अप ऑफ 4 different types of cells. So granuloma is made up of your normal macrophage. It is made up of normal macrophage. It is made up of epithelioid cells. मैंने epithelioid लिखा है, epithelial नहीं. It is made up of histiocytes and it is made up of interferon gamma. So these are basically 4 substance, or I can say 4 types of cells which form granuloma. अब आपसे क्वेश्चन क्या पूछते हैं, दे आस्क यू विच टाइप ऑफ क्वेश्चन एग्जाम, कि ग्रैनुलोमा कहाँ कहाँ मिलता है, कौन कौन से शेप का. सो वी हैव डिफरेंट टाइप ऑफ ग्रैनुलोमा. So understand this thing, and granuloma is made up of these 4 cells. So this is very very important. Epithelioid cells. Done. Epithelioid cells. Now what else they ask you? They ask you question on giant cells. So what are the different types of giant cells? कौन से type के giant cells होते हैं? So we have first type called foreign body giant cells. Foreign body giant cells. Second type of giant cell is called Langerhans giant cells. Third type is called Taunton giant cells. Fourth is called your Reed-Sternberg giant cells. Then we have Warthin-Finkelde giant cells. So foreign body giant cells you will see whenever we have some foreign body. जब कोई foreign body होगी तो foreign body giant cells. So when we have inflammation with any foreign body, you will get foreign body giant cells. Langerhans giant cells you will see in TB. Coming to Taunton giant cells, this is something which we see in xanthoma. Reed-Sternberg cells you will see in Hodgkin lymphoma. And Warthin-Finkelde you will see where in measles. So these are the different types of giant cells which you have to remember, right? एक और होते हैं osteoclastic giant cells. Basically these are seen like in bone tumor. So just let me write one more. Osteoclastic giant cells. So where you see, so these are those where we see them in bone tumor. These are seen in bone tumor. ओके. नाउ डाउन पटाओ एडवर्ड से बार बार क्वेश्चन आता है. माइटोकॉन्ड्रियल हमने पढ़ चुके थे. जैसे मेंबर फ्रॉम फादर नो वन एंड फ्रॉम मदर it will affect all babies. And the classical example which you have to remember is MELAS, NARP, LH1. MELAS is mitochondrial encephalopathy, lactic acidosis, stroke. NARP is neuritis, ataxia, retinitis pigmentosa. LH1 is labor hereditary optic neuropathy. Then we have CPEO, chronic progressive external ophthalmoplegia. So these are the examples. Now down Patau Edward, understand this thing. So D for Down syndrome, D for drinking age is 21, P for puberty age, P for Patau syndrome, puberty age is 13, E for Edward, E for election age is 18. So trisomy 21, 13, 18. अब ध्यान से देखो, डाउन तो हमने पढ़ लिया था इन डिटेल. सो दीज डिसीजेस, अंडरस्टैंड दिस, all these diseases they will have few similarities. So what are the similarities? So similarities समझो. So first similarity is in Down Patau Edward, all you will see mental retardation. इन ऑल मोस्ट कॉमन कॉज विल बी ट्राइसोमी. तो तीनों में क्या हो रही है? ट्राइसोमी हो रही है. And trisomy, generally this most common cause for trisomy will be meiotic non-disjunction. All will have some GIT defect, all will have some heart defect, right? सब में कोई ना कोई GIT का डिफेक्ट होगा, हार्ट डिफेक्ट होगा, and all will have some sort of kidney defect also. So these are the similarity. Now point is पटाओ और एडवर्ड को कैसे आप डिफरेंशिएट करोगे? So remember P for पटाओ, and here what we have Edward. So understand in Patau syndrome and Edward syndrome how we can differentiate. So Patau, P for Patau, P for polydactyly. इसमें पेशेंट के पास उंगलियां ज़्यादा होंगी, मीन्स मोर देन 5 फिंगर्स. इन एडवर्ड यू विल नॉट सी, फिंगर्स विल बी सेम बट वो एक के ऊपर एक ऐसे चढ़े होंगे. वी कॉल दिस ओवरलैपिंग फिंगर. We call them as overlapping fingers. Then अगर मैं बात करूँ पटाव syndrome, in पटाव syndrome you will notice polydactyly and you will notice palate will have defect. So P for palate. Palate or lip will have cleft. So cleft lip और palate होगा. Edward में you will not see this. Then there is a term called rocker bottom feet. So rocker bottom feet you will see classically in Edward, but याद रखना rocker bottom feet you can also see in Patau, but it is more classical for Edward. So these are the difference which you have to remember, जो आपको याद रखना. Done? Am I clear? Okay, now moving to Klinefelter and Turner. इसके बारे में बात करते हैं. So they are pretty much simple. Just आपको एक को उल्टा कर देना है. So karyotype will be XXY. Karyotype कितना होगा? XO. If you ask me bar body is 1. Here bar body will be 0. Height कैसे होगी? Tall. Height कैसे होगी? Short. IQ, it is slightly low. IQ will be normal. Then if you see like Klinefelter patient, they will have MVP. MVP can convert into MR, mitral valve prolapse. Here you will find bicuspid aortic valve. Bicuspid aortic valve, and patient can also develop coarctation of aorta. Coarctation of aorta. तो देखो इसको समझो. इसको क्लाइनफिल्टर एक लड़का है जो लड़कियों जैसा है, टर्नर एक लड़की है जो लड़कों जैसी है. सो अंडरस्टैंड दिस थिंग. इन क्लाइनफिल्टर पेशेंट विल हैव इट्स अ मेल विथ feminine feature. So in simple language I can say female like skin, hair and fat. Fat distribution भी female जैसा होगा. In Turner you will see like there is like a flat chest and widely spaced nipple. Widely spaced nipples. So these are the differences which you have to remember in Klinefelter and Turner syndrome. Done? आगे चलो. Okay, now understand we have fragile X syndrome. अब इसको समझते हैं. Fragile X syndrome. So they ask you a lot of time question from this fragile X syndrome. So it is due to FMR1 gene. So fragile X syndrome, this is second most common genetic cause of mental retardation. अब इसको देखो. In fragile X syndrome you will see patient will have a small nose, everything else is bigger. So what else is bigger? So understand this thing. नाक को छोड़ के, so they will have large ear, कान बड़े बड़े होंगे. अ लॉन्ग फेस, एक लंबा चेहरा होगा, मैक्रो ऑर्किडिज्म, टेस्टिस भी बड़े हैं. So this is something that you should know about fragile X syndrome. Fragile X syndrome. Okay, now let's talk about some immunity topics. So immune systems में आपके कुछ cells होते हैं. We should talk about these cells. So what are the types of cells? Any doubt, guys? Rishabh, Anuj, any doubt to anyone? So we have different types of cells in immune system. कौन कौन से cells होते हैं? What are the main cells? कौन से main cells होते हैं? So we have main cells and we have APCs. So we have main cells. Main cells are T lymphocytes, then we have B lymphocytes and NK cells. Then what we have APC. APC means antigen presenting cells. So these are B lymphocytes, macrophage, and most important APC will be dendritic cells. So most important APC will be dendritic cells. Then understand this thing, we have different types of pattern recognition receptors. So what are pattern recognition receptors? कौन से receptors होते हैं? So we have like nod like receptors. Nod like receptors. Then what else we have? और कौन से receptors होते हैं? What type of receptors we have? We have receptors called rig like receptor. बताओ. Yes, come on. बताओ और कौन से receptors होंगे? Then understand we have receptors like we call these receptors like C-type receptors. C-type receptors. Right? और बताओ. Anyone else? What are other type of receptors you have? Come on. और कौन कौन से होते हैं? Yes. We have nod type receptors. Yes, very good. और बताओ. अनुज, ऋषभ, कहाँ गायब हो गए एकदम से सारे के सारे लोग? खाना खाने चले गए क्या? पेपर निकाल लो, खाना वाना सब बाद में खा लेना. यू विल गेट टाइम टू ईट. बताओ बताओ बताओ. सी टाइप को यस CLR बोलते हैं इसको. यस. और बताओ. व्हाट एल्स वी हैव? वी हैव वेरी वेरी इंपॉर्टेंट टोल लाइक रिसेप्टर. टोल लाइक को हम TLR बोलते हैं. So these are the receptors. Now what type of question they ask you? They ask you question on these receptors. Receptors से क्या question पूछते हैं आपसे? बताओ. So understand this thing. This nod receptor mutation you will see where in IBD, inflammatory bowel disease. These are most abundant receptor. Most abundant receptor will be toll-like receptors. Most abundant are toll-like receptors. That. Okay, now understand they ask you question on MHC. What is MHC? MHC means major histocompatibility complex. तो MHC के कुछ types होते हैं जो आपको पढ़ने. So we have MHC type 1 और class 1, MHC class 2, and we have MHC class 3. MHC class 1 will take the cells to CD8 T cells. Class 2 will take the cells to CD4 T cells. So understand this thing. MHC class 1. So 1 into 8 is equal to 8. 2 into 4 is equal to 8. So याद रखना multiplication 8 ही आना चाहिए. MHC class 3 is a new class. This is mainly coding for heat shock protein. It's a new class. So this will code for heat shock protein. And this will participate in many, I can say, autoimmune disease. It will participate in many autoimmune diseases. MHC class 1. Now understand this class 1. This is generally like present in all nucleated cells. All nucleated cells. तो किस में एब्सेंट होगा? सो दिस इज, रिमेंबर, इट इज एब्सेंट इन आरबीसीज, इन मैच्योर आरबीसीज. एंड क्लास 2, अगर मैं बात करूँ एमएससी क्लास 2 की, दिस इज समथिंग विच इज प्रेजेंट इन ऑल एपीसी. It is something which is present in all APCs. Okay, now moving to amyloidosis. Amyloidosis is one short question in exam. So just remember, diagnose करने के लिए we have to do biopsy. That biopsy, the preferred site will be abdominal fat pad. Abdominal fat pad biopsy. Second best site you can take sample either from gingiva or we can take sample from rectum. Biopsy करने के बाद what we do, we see them under like I can say which stain. That stain is called Congo red. Congo red से आप stain करोगे and it will have apple green color under polarized microscopy. So देखो, एक तो ये तो रिपीट क्वेश्चन जो बार बार पूछते हैं, लाइक एप्पल ग्रीन कलर. नाउ दे आस्क यू व्हाट आर द वेरियस टाइप्स ऑफ एमिलॉइड एंड वेयर वी सी देम. कौन सा, दीज आर, व्हाट आर द वेरियस टाइप्स ऑफ एमिलॉइड. सो वी हैव फर्स्ट टाइप ऑफ एमिलॉइड, आई एम राइटिंग AL टाइप. AL को बोलते हैं प्राइमरी एमिलॉइड. इट इज सीन इन मल्टीपल माइलोमा. सेकेंड टाइप इज कॉल्ड एज AA टाइप. वी ऑल्सो कॉल दिस सेकेंडरी एमिलॉइड and this is something which we see in chronic inflammation. So याद रखना, all chronic inflammation will have this except chronic bronchitis. Chronic inflammation. This A type also you can see where, you can see this where, somewhere else और कहीं मिलता है A type, you can see this where, in familial Mediterranean fever, FMF, familiar Mediterranean fever. Next type is called as, then we have A Cal type. It is seen in MTC, medullary thyroid carcinoma, and MTC occurred due to RET gene mutation. Then we have like amyloid called amylin. This is seen where, in pancreas, or they can ask you, it is something which we see in diabetes. Amylin is also called as islet associated pancreatic polypeptide. Next amyloid which you have to remember is A beta and A beta 2M. So A beta amyloid, understand, this is seen where, in your brain, and A beta 2M, it is seen in your kidney. In brain where, in Alzheimer disease, and kidney we also call this as dialysis associated amyloid. It is called dialysis associated amyloid. Then we have last amyloid which is important, ATTR. It is present in your heart, and it is also important in two familial syndrome. First is called as senile systemic amyloidosis, and familial amyloidotic polyneuropathy. Senile systemic amyloidosis and familial amyloidotic polyneuropathy. So these are the various types of amyloid which you have to remember. Done. Okay, now let's talk about the various graft. So graft से देखो आपसे क्या क्वेश्चन पूछते हैं. So from graft, what type of question they ask you in exam? They ask you like which type of graft, या तो सिंपल पूछ लेंगे, और they ask you question on graft rejection. So mainly जो आपसे क्वेश्चन एग्जाम में पूछा जाता है, that is based on graft rejection. So what are the types of graft rejection you know? तो पहले graft की बात कर लेते हैं. So I told you we have autograft. Autograft means same body, within same body. Then we have allograft, between same species. So this is actually most common type of graft. Then we have xenograft. Xenograft is between different species. It is between different species. Then what we have isograft. It is between identical twins. So these are the different types of graft, right? Now they ask you, understand, they ask you question in exam like what are the different types of like grafts. So we have two diseases which you have to remember. So आपसे क्वेश्चन पूछते हैं ग्राफ्ट रिजेक्शन से. So graft rejection. So understand graft rejection, it could be hyperacute, it could be acute rejection, or it could be like I can say chronic. So hyperacute means suppose अभी आपने transplant किया, just now today you did transplant, or today, or I can say maybe within 24 hours it get rejected. It means it is like rejection which occur immediately, right, or within 24 hours. Acute means it occur within few weeks. And suppose if occur after few months to few years. Few months to few years. तो 24 घंटे से पहले हो गया या ऑपरेशन टेबल पर ही हो गया, वी कॉल दिस हाइपर एक्यूट. सो अंडरस्टैंड दिस थिंग. अब इसको समझो एक बार. दे आस्क यू दिस हाइपर एक्यूट इज ड्यू टू प्री फॉर्म्ड एंटीबॉडी. This acute, understand, acute occur due to T cell action. Acute क्यों होगा? Because of T cell action. And if you ask me this chronic, understand, this basically what happened. Acute में क्या होगा? T cell mediated immune response, right? You can see like inflammation, and you can see leukocytes or basically lymphocyte infiltration. तो WBCs infiltrate कर जाएंगे. Leukocyte infiltration. एंड क्रोनिक क्यों होगा? इट अकर बिकॉज ऑफ फाइब्रोसिस. अंदर क्या होगी? फाइब्रोसिस होगी. तो यू कैन नोटिस देयर इज फाइब्रोसिस, और आई कैन से थिकनिंग और स्क्लेरोसिस ऑफ द वेसल्स. तो उसको हम आर्टीरियोपैथी भी बोलते हैं. वी ऑल्सो कॉल दिस एज आर्टीरियोपैथी. These are graft rejection. Okay, now coming to the most important thing, they ask you a question on tumor marker. Very, very important slide. Tumor marker. So this is like a rapid revision. The purpose of this class is to give you maximum information in minimal time. So वही हमारी strategy है यहाँ पर. So ALP means alkaline phosphatase. ALP you will see where in Paget disease of bone. Then you can see NSE, neuron specific enolase. It is for neuroblastoma. So N for N, ये तो याद हो जाएगा. N for N. Small cell, small को नूनू भी बोलते हैं, तो ये भी याद हो जाएगा. Small cell lung cancer और नूनू cell lung cancer. Catecholamines, epinephrine, norepinephrine, these are increased where in pheochromocytoma. Prostate specific antigen and prostatic alkaline phosphatase, prostate cancer. Chromogranin is immunohistochemical marker for carcinoid tumor. CEA कई जगह होता है, but remember this is the best marker. It is best marker for colon cancer. सो कोलोन कैंसर के लिए बेस्ट मार्कर क्या होता है? CEA 15, 99, 125. सो 27, 29 को छोड़ दो. नोबडी विल आस्क यू दिस. नाउ लुक एट द स्क्रीन केयरफुली. अब मैंने ये क्या बना दिया यहाँ पर, ध्यान से देखो. Look at the screen carefully and try to understand this. नंबर में पहले 15 आ रहा है, फिर 19 आ रहा है, फिर 125 आ रहा है. तो 15, 19, 125. So understand this thing. Similarly, when you see a female body, so first you will see breast. तो पहले ब्रेस्ट आ रही है, तो 15, then you will see colon pancreas, then you will see colon pancreas, and ultimately you will see ovary. So understand this thing, अगर आप नंबर देखोगे पहले 50, 19, 125, similarly understand this thing, if you see a female body from top to down, so first you will see breast, then you can notice, so just मैं यहाँ पर ऐसा लिख दे रहा हूँ, फिफ्टीन, 19, 125, simple. So 15 is for breast, 99 colon pancreas, 125 is for ovary. Calcitonin, understand, calcitonin is a marker for MTC, and remember this MTC, it occurred due to mutation of which gene? Ret gene. ये बार बार पूछते हैं. It occurred because of Ret gene mutation. Alpha fetoprotein, it is very very important. ये क्वेश्चन कई बार आ चुका है for HCC, and remember it's also a marker for yolk sac tumor. Yolk sac tumor, HCC, hepatoblastoma. Beta HCG, it is a marker, it's a normal marker for pregnancy also. So अगर आप pregnant नहीं हो और beta HCG बड़ा हुआ है, then you are in trouble. It means it's a marker for hydatid-form mole, इसको molar pregnancy बोलते हैं, like hydatid-form mole, complete mole, partial mole, we call this molar pregnancy. Testicular cancer, choriocarcinoma. Okay, now coming to the most important thing. सारी जेनेटिक्स एक तरफ, ये टेबल एक तरफ, ध्यान से देख लो. दिस इज वन शॉर्ट क्वेश्चन इन अपकमिंग एग्जाम. किसी भी एग्जाम में बार बार यहाँ से क्वेश्चन पूछते हैं. सो विच डिसीज विल हैव autosomal dominant pattern, which disease will have autosomal recessive pattern, this type of question they ask in exam, they keep on asking this. So understand this thing. अब इसको देखते हैं कैसे, पहले समझो एक बार. Autosomal dominant disease will have few features, कुछ इसके features होते हैं. So what are those features? The first features will be, you will notice in autosomal dominant you will see variable expression. वेरिएबल एक्सप्रेशन मीन्स हो सकता है दो लोगों को सेम बीमारी हो लेकिन दोनों को अलग अलग सिम्टम हो. टू पीपल में हैव सेम डिसीज बट विद डिफरेंट सिम्टम. सेकंड इज इनकम्प्लीट पेनिट्रेंस. इनकम्प्लीट पेनिट्रेंस मीन्स टू पीपल में हैव सेम डिसीज बट वन पर्सन इज एब्सोल्युटली नॉर्मल. दो लोगों को सेम बीमारी है लेकिन एक इंसान के अंदर बीमारी पेनिट्रेट ही नहीं करी, तो वो नॉर्मल, उसको कोई सिम्टम ही नहीं. नाउ अंडरस्टैंड. So here we have von Willebrand disease, familial adenomatous polyposis, hypercholesterolemia, which is familial hypercholesterolemia, ADPCKD, myotonic dystrophy, osteogenesis imperfecta, Marfan syndrome, intermittent porphyria, NF1, NF2, achondroplasia, tuberous sclerosis, Huntington chorea, hereditary spherocytosis. तो मैं यहाँ पर आपको बता रहा हूँ कि देन वी हैव फैमिलियर एटोब्लास्टोमा, इक्थियोसिस वल्गैरिस. कितने क्वेश्चन आए? सो लुक एट द स्क्रीन. अब मैं क्वेश्चन मार्क कर रहा हूँ जो क्वेश्चन आपके एग्जाम एफएमजी स्पेसिफिक क्वेश्चन आए. So these are the question came from autosomal dominant only. Now coming to autosomal recessive. Phenylketonuria came in exam, galactosemia came in exam, cystic fibrosis आ चुका है, hemochromatoses भी आ चुका है, Wilson's came. Okay, now remember, all lysosomal storage disease, all are autosomal recessive except two. So what are these two? Just look at the screen. These two are here. तो ये दोनों यहाँ लिखिए. Which two? Except Hunter, right? So Hunter disease is something and Fabry. So Hunter और Fabry को छोड़ के बाकी सारी कैसे? Autosomal recessive except Hunter and Fabry. Then you can notice sickle cell anemia came, thalassemia came, homocystinemia came. एक और one more they ask you like acrodermatitis enteropathica. Acrodermatitis enteropathica. This is also autosomal recessive, right? Now coming to X-linked dominant condition. So X-linked dominant condition, we have hypophosphatemic rickets, incontinentia pigmenti, orofaciodigital syndrome, Alport syndrome. हेलो, मैं मेडवे में हूँ, मैं मेडवे में ऑफलाइन पढ़ाता हूँ. यस, आई एम इन मेडवे ऑफलाइन, आई टीच इन मेडवे ऑफलाइन. X-linked dominant condition, we have high in outer port. Just remember one more. What we have? We have Rett syndrome. One more is Rett syndrome. एक और होता है गोल्ड, पर उतना इंपॉर्टेंट नहीं है. सो रिमेंबर दीज टू. दो क्वेश्चन आए हुए हैं यहाँ से, एल्पोर्ट एंड रेट सिंड्रोम. सो दीज आर एक्स लिंक डोमिनेंट कंडीशन. एक्स लिंक डोमिनेंट होगा तो ये फीमेल्स में ज़्यादा होगा. Okay, now coming to X-linked recessive. So these are the ones which will affect only boys. These will affect only boys. So here we have Lesch-Nyhan syndrome, hemophilia A and B. Okay, hemophilia A and B. अब बच गया hemophilia C. तो hemophilia C यहाँ पर आएगा. Hemophilia C, it autosomal recessive. Hemophilia C का एक नाम होता है, कौन बताएगा मुझे? Anyone? Who will answer me? Hemophilia C को कुछ बोलते हैं. Anyone? बताओ. Hemophilia A is called classical hemophilia, B is called Christmas disease, C को क्या बोलते हैं? Come on. C is called as Rosenthal syndrome. Rosenthal syndrome. So just ध्यान से देख लो. This is one short question which they ask in exam. Very very important. Right, about this table. Okay, next is we have hypersensitivity. अब एक क्वेश्चन आपसे hypersensitivity पूछते हैं. So remember, so we have type 1, 2, 3, 4. So type 1 is called anaphylactic. Type 1 is called anaphylactic. Type 2 is called as cytotoxic. Type 3 is called as immune complex. And type 4 is called delayed. Type 4 is called delayed. So remember, mnemonic is acid. So type 1, 2, 3, 4 आपको कैसे याद रखना है? Acid, ACID. Now type 5 is the type which is derived from type 2. Type 2 is derived type 5. So here we have two conditions, myasthenia gravis and grave disease. So myasthenia gravis and grave disease. सब एक बार देख लेते हैं type 4 को. So we have tuberculin test, lepromin test, autoimmune disorders like sarcoidosis, Crohn disease, contact dermatitis, multiple sclerosis, chronic graft rejection and temporal arthritis. टेम्पोरल आर्थराइटिस को और क्या बोलते हैं? जाइंट सेल आर्थराइटिस. जाइंट सेल आर्थराइटिस. नाउ कमिंग टू टाइप 3. सो टाइप 3 यू कैन रिमेंबर बाय निमोनिक शार्प. शार्प, SLE, शिकटेस, सीरम सिकनेस, हाइपरसेंसिटिव न्यूमोनाइटिस, आर्थस रिएक्शन, रिएक्टिव आर्थराइटिस, पान, PSG. टाइप 2 मायस्थेनिया, तो वहाँ पहुँच गया. तो मायस्थेनिया देखो, मायस्थेनिया से दोनों क्वेश्चन आए हुए. अगर इफ़ यू गेट दिस टाइप ऑफ क्वेश्चन, मायस्थेनिया ग्रेविस इज विच टाइप ऑफ हाइपरसेंसिटिव? टाइप 5 ऑप्शन में नहीं. सपोज दे आस्क यू 1, 2, 3, 4, देन आंसर इज टाइप 2, राइट? बट इफ टाइप 5 इज गिवन, बिकॉज इन मेनी स्टैंडर्ड टेक्स्ट बुक टाइप 5 इज स्टिल नॉट गिवन, अभी तक नहीं दिया हुआ. नाउ कमिंग टू टाइप 1. अब टाइप 1, टाइप उसको देख लो. टाइप 2 कैसे याद रखोगे? यू कैन रिमेंबर लाइक ब्लड ग्रुप इज RH positive. So how we can remember this? Blood group is RH पॉजिटिव. अब इसको देखो, जितने भी एलर्जी हैं, ऑल एलर्जीज आर टाइप 1. All allergy means asthma allergy, hay fever allergy, allergic rhinitis, allergic dermatitis, food allergy, एटोपिक डर्मेटाइटिस का दूसरा नाम होता है एलर्जिक डर्मेटाइटिस, अर्टिकेरियाज एलर्जी, एंजियोडेमा है सिवियर फॉर्म ऑफ एलर्जी. सो ऑल एलर्जी, ड्रग एलर्जी, फूड एलर्जी, पोलन एलर्जी, डस्ट एलर्जी आर टाइप 1. Antibiotic reaction, especially penicillin type 1. Then remember, any type of sting or bite, any type of sting like scorpion sting, scorpion kin, bee sting, snake bite, I can say bee sting, snake bite, mosquito bite, fly bite, dog bite, cat bite, love bite, ये सारे bite वाइट किस में आएंगे, सब all will be type 1. So bite allergy, these are type 1. All types of bite, all type of sting, all type of allergies type 1. That. Okay, now coming to the CSF changes. So here they will ask you like a pathomedicine overlap question. So what are the CSF changes in meningitis? अब इसको देखो. It's a very simple thing. So normal value, let's see first. So let's see the normal value. So normally you will see less than 5 lymphocytes in CSF. Glucose कितना होता है? Understand? Glucose is 2/3 of blood glucose. So normal CSF glucose will be, it is 2/3 of blood glucose, right? So it is like 40 to 85, or I can say average देखो तो 66.66. जितना again जिसकी body में blood में like diabetics, they have more sugar in their blood, so they will have more sugar in their CSF as well. So understand this thing. जैसे suppose मेरी body में right now my blood sugar is 100, तो CSF में कितना होगा? 66. Simple. 2/3. So understand, normally you will see 15 to 45 proteins and pressure will be 70 to 80 millimeter of water. Now understand, whenever you see a question on meningitis, तो सबसे पहले आप क्या देखना है? You have to see first thing is CSF glucose. So remember, bacteria love glucose. Bacteria love glucose. So we have 3 type of meningitis: purulent or bacterial, aseptic or viral, and granulomatous means tubercular. सो बैक्टीरिया में क्या होगा? बैक्टीरिया दे लव ग्लूकोज, सो ग्लूकोज विल, इसको देखो रटना नहीं, समझो इसको. बैक्टीरिया लव ग्लूकोज, सो ग्लूकोज विल बी रिड्यूस्ड. टीबी इज ऑल्सो बैक्टीरिया. वायरस डोंट लव, तो वायरस में कैसा होगा? नॉर्मल. तो अगर क्वेश्चन में देखो ध्यान से, लिसन टू मी वेरी केयरफुली. इफ इन द एमसीक्यू ग्लूकोज इज गिवन नॉर्मल, तो वो वायरल है, सिंपल. देन अंडरस्टैंड, इफ इट इज बैक्टीरिया देन सेल्स विल बी न्यूट्रोफिल्स. इफ इट इज वायरल और TB, then cells will be lymphocytes. तो पहले आपको ग्लूकोज देना. जैसे मेंबर अप्रोच है, सबसे पहले यू हैव टू सी ग्लूकोज. सबसे पहले क्वेश्चन में ग्लूकोज को देखना है, उसके बाद देखने सेल्स. और याद रखना, प्रोटीन प्रेशर सब जगह बढ़ता है, सो यू डोंट हैव टू सी दिस. यू कैन सी, देखो सब तीनों में बढ़ा हुआ है, प्रोटीन तीनों में बढ़ा है, प्रेशर तीनों में बढ़ा हुआ है. सो दिस इज नथिंग, यू डोंट हैव टू सी दिस. तो प्रोटीन प्रेशर को छोड़ दो. So first see glucose, second then see the cells. Simple. Done. Okay, now coming to brain tumors, meningioma. So understand, in meningioma, this is the tumor which originates from meningoepithelial cells, or they ask you a question, tumor originates from arachnoid villi. Then you can see here, second thing is, you can notice here some bodies, and patient will have, like, it is either asymptomatic, or I can say some people they will have headache, or sometime it can present with seizures. So these are MCQs on meningioma. Just one more thing I want to add about meningioma is, it is a tumor which is more in females, and that is due to progesterone. तो पेशेंट जब प्रेग्नेंट होगी, तो इन प्रेगनेंसी यू विल सी मोर प्रोजेस्टेरोन, तो सिम्टम्स विल इंक्रीज in pregnancy. So symptoms will be more whenever patient is pregnant. Simple. Coming to hemangioblastoma, right? This hemangioblastoma, understand, it is associated with von Hippel-Linde syndrome. Okay, schwannoma से क्वेश्चन पूछते हैं. Schwannoma is also called as acoustic neuroma. Schwannoma, we also call this as acoustic neuroma. In ENT we call this acoustic neuroma. This is I can say a most common CP angle tumor, cerebellopontine angle tumor, right? And this is like affecting your vestibulocochlear nerve, so patient will have sensorineural hearing loss. There will be SNHL. Now coming to the schwannoma, if you do biopsy, in biopsy you will find verrucae bodies. Verruca bodies, and this Verruca bodies will have two pattern. So first is called Antony A pattern, it is a hypercellular pattern, and second will be Antony B pattern. Antony A pattern, Antony B pattern. So this is something which you have to remember about schwannoma. Oligodendroglioma मैंने आपको बताया था. We also call this non-wedge tumor. You can see perinuclear halo called fried egg appearance. You can see capillary network chicken wire pattern. And last thing which you have to remember here is IDH1 mutation. IDH1 mutation. Prolactinoma or pituitary adenoma. So understand this thing. So most common will be non-functional microadenoma. And after this I can say second after this will be prolactinoma. तो कभी कभी ऑप्शन में they don't give you non-functional, then answer will be prolactinoma. And this tumor can compress optic chiasma, so patient will develop bitemporal hemianopia. Glioblastoma multiforme, I told you pseudoparasitic body, and sometime you will see glomeruloid body. And this is also called as butterfly tumor because tumor will have trans हेमिस्फीयर स्प्रेड, एक हेमिस्फीयर से दूसरे हेमिस्फीयर में जाएगा. Tumor will spread from one hemisphere to another hemisphere. So this is the summary, short summary of all the brain tumors. Simple. Done? Am I clear? आगे चलें. Done? Any doubt guys? आगे चलो. Okay, now moving to the question which they ask on what are the various naming or peripheral smear findings. So देख लो एक बार. This is again one short question in exam. So let's see this. Abnormal size of a cell is called as anisocytosis. अगर शेप एबनॉर्मल होगा उसको बोलते हैं पॉइकुलोसाइटोसिस. दोनों ही होंगे इसको बोलते हैं एनाइसोपॉइकुलोसाइटोसिस. सो दीज आर सीन इन IDA, आयरन डेफिशिएंसी एनीमिया. इसको बोलते हैं एनाइसोपॉइकुलोसाइटोसिस. राइट. सेम थिंग व्हेन यू सी इन पेरिफेरल स्मीयर. तो कैसे पता चलेगा? RDW बड़ा होता है, रेड सेल डिस्ट्रीब्यूशन विल बी बिगर. इलिप्टोसाइटोसिस मीन्स RBC विल बिकम इलिप्सॉइडल. इलिप्सॉइडल मीन्स RBC अंडे के जैसे दिखेंगी. दिस इज सीन वेयर इन हेरिडिटरी इलिप्टोसाइटोसिस. Spherical RBC become like a spear. We call this hereditary spherocytosis. So it is seen in hereditary spherocytosis, AIH, and sometime in burn patient. Same spherical cell ही होगा, बस बीच में एक target होगा. You can see a target in the center. We call this target cells. Acanthocytes you will see where in A beta lipoproteinemia. Burr cells, these are echinocytes, again not that important. Cystocytes, these are broken RBCs. These are broken RBCs, or these cystocytes are broken RBCs, or what we call them? We call them helmet cells. Cystocytes are broken RBCs and we also call them helmet cells. So understand, these cystocytes ये कहाँ पर मिलते हैं? These are broken fragments of RBCs. They are seen in MAHA, and MAHA is seen in HUS, hemolytic uremic syndrome. Bite cells you will see in G6P deficiency. Bite cells, and here also you will see Heinz bodies. So Heinz bodies are nothing. These are bodies. Inside this you will find a red color pigment. So denatured hemoglobin means ऐसे cells होंगे, उसके अंदर क्या है? रेड कलर की बॉडीज. अगर आपको ब्लू कलर की बॉडी दिखती है, ब्लू विल बी न्यूक्लियस. सो इफ यू सी ब्लू कलर बॉडी, suppose if you see this cell and in this you are having blue color body, so blue will be nucleus remnant. So this blue is nucleus remnant, and this is called as Howell Jolly body. Howell Jolly body. This is nucleus remnant. Coming to dacrocytes. Dacrocytes means these are called tear drop cells. This look like this, a drop of tear. Drepanocytes. These are sickled RBCs. They look like sickle. रोले फॉर्मेशन मीन्स आरबीसी एक के ऊपर एक जमा हो जाएंगे लाइक दिस. वी कॉल दिस रोले फॉर्मेशन. इट इज इन मल्टीपल माइलोमा. हाइंस बॉडीज ऊपर हमने पढ़ लेते, जिस इज पी डेफिशिएंसी. पैपनिमर बॉडीज ऑल्सो आई टोल्ड यू पोस्ट प्लेनेक्टोमी, एंड दिस इज ऑल्सो सीन इन सिड्रोब्लास्टिक अनीमिया. Ring cells you will see in sideroblastic, basophilic stiffening you will see in lead poisoning. So these are all the peripheral smear findings in one slide. Very very important. ध्यान से देख लो. These are all the peripheral smear finding which they can ask you in exam. Done? Okay, आगे चलते हैं. Now we need to differentiate different types of leukemia. तो पहले देखो ध्यान से. So in leukemia question, first thing is you need to see percentage of blast cells. So if blast cells are more than 20, they are more than 20%, then remember, then it is acute leukemia. अगर 20 से कम है तो कैसे होंगे? chronic, right? So understand this thing. AML, in AML you will find intracytoplasmic rod like structure. These rods are called Oyer rods. We call them Oyer rods. Myeloid cell set will be positive for MPS Sudan black. So we have different type. The most common type is M2, but most important type will be M3. M3 will have maximum Oyer rods. M3 will have DIC. Then understand M5 will have gingival hyperplasia or gingival infiltrate, and M7 is something which is associated with Down syndrome, right? So in treatment what we give? We give ATRA. So ATRA we give where? All trans retinoic acid. So understand this thing. ATRA we will use where? In M3 type. ATRA. So most important type which you have to remember, जो आपको याद रखना है, most important type ये कौन सा होगा? This will be your M3 type. This will be your M3 type. Done. Okay, now let's talk about CML. CML is having translocation 922. इसको बोलते हैं Philadelphia chromosome. Philadelphia chromosome. So there is BCR ABL gene fusion. You will get protein 210. And this protein will have tyrosine kinase activity. So lab score is decreased and drug of choice will be imatinib. Sometimes you will notice CML can convert into AML. जब CML AML में convert होगा, now understand this thing. इसको बोलते हैं blast crisis. We call this blast crisis. CML can convert into AML. Done. Similarly, let's differentiate Crohn's disease and ulcerative colitis. Crohn's disease and ulcerative colitis. So, देखो Crohn's disease, it can occur anywhere from mouth to anus, but most common site will be ileum. Ulcerative colitis, you will see it will affect rectum and colon, but most common will be rectum. So, most common manifestation will be proctitis. Proctitis means inflammation of rectum. You can notice in I can say in Crohn's disease you will see skip lesion. Here you will see continuous lesion. You can see fissures, cobblestone appearance. You can see non-cacheating ganglioma. Here you can see extensive ulceration, pseudopolyps, cryptapsis. Inflammation is transmural. It is limited to mucosa and submucosa. Then remember in Crohn's disease, what else you can notice? You can see string signs of contour. You can see fistulas, you can see serpentine ulcers. Here you will see toxic megacolon and lead pipe deformity. So understand this thing. Complication दोनों में cancer हो सकता है. So even cancer can occur here also. So cancer just I am writing here also. So cancer दोनों में हो सकता है. Antibody will be ASCA, anti-Saccharomyces cerevisiae. Here antibody will be P-ANCA. ANCA में भी कौन सी? Priyanka. So here smoking is bad, you should stop smoking. Here smoking is protective. So these are the difference between Crohn disease and ulcerative colitis. अगर मैं बात करूँ like which disease have more relapse, so Crohn's will have more relapse. Why? Because ये कहीं भी हो रही है ना, it can involve any part. So more chance of relapse you will see where in Crohn disease. In Crohn disease you will see more chance of relapse. Done. Okay, now let's talk about GIST. What is GIST? Gastrointestinal stromal tumor. So this is like a tumor which originates from. कौन बताएगा मुझे GIST के बारे में? Anyone can tell me about GIST? It's a tumor originate from interstitial cells of Cajal. These are called pacemaker of GIT. Most common site of GIST will be stomach. And remember, in GIST the treatment is also imatinib. So imatinib today I told you in two places, in GIST as well as CML. So these are two places where imatinib is drug of choice. Okay, achalasia cardia, failure of LES to relax. So you can notice in achalasia what they ask you. So we can have primary achalasia and secondary. The secondary achalasia is associated with Chagas disease. Secondary is something which is associated with Chagas disease. Yes, we have c-KIT mutation. Yes, very good. And we have DOG1. Right? Am I clear? These are the markers of GIST. तो अक्लेशिया से आपको कई सारे क्वेश्चन पूछते हैं एग्जाम. सो लाइक दे आर बेसिकली इजी क्वेश्चन. इन बेरियम यू विल फाइंड विच साइन? बर्ड बीक साइन. Right? And remember, investigation of choice is manometry. And treatment of choice, it will be a surgery, and this surgery is called as Heller's myotomy. Okay, now moving to, we have other GI condition like Barrett esophagus, GERD. So Barrett मैंने आपको बताया था, squamous epithelia in Barrett, it will convert into intestinal type of columnar. And this intestinal type of columnar is special because it will have goblet cells. Right? And remember, in Barrett, in long term, there is risk of adenocarcinoma only. Barrett किस में कन्वर्ट नहीं होगा? स्क्वेमस में कन्वर्ट नहीं होगा, only adenocarcinoma. GERD is gastroesophageal reflux disease. Just remember, this is most common cause of angina. अगर किसी को छाती में दर्द हो रहा है, anybody is having pain in the chest, then most common cause is not MI, most common cause is always GERD. Now understand, gastroesophageal reflux disease is GERD. So they ask you how we can make a diagnosis. So basically in practice we don't do much, but they ask you how we make a diagnosis. So we can do like endoscopy, or to confirm this we can go for 24 hours pH monitoring. So treatment of choice will be PPI. Now coming to feline esophagitis, or we also call this hypereosinophilic. So basically eosinophils are more. इससे आपसे क्वेश्चन पूछते हैं लाइक एंडोस्कोपी विल हैव अ क्लासिकल पैटर्न. वी कॉल दिस मल्टीपल corrugated fold or corrugated appearance in endoscopy. In endoscopy you will find multiple corrugated appearance. Okay, now moving to gastritis and peptic ulcer disease. So we have different types of gastritis. Like we can have type A gastritis, We can have type B gastritis, type A and type B. So understand this thing, this type A gastritis. Type A gastritis, this will affect body. Type B gastritis, it will affect antrum. Type B will affect antrum. So type A body, type B antrum. So type B is most common type, and type B, understand, this occur due to H. pylori. Type A is more common in exam, I can say. Type B is more common in practice. Type A is more common in MCQs. So this you can remember by mnemonic FA. FA means, understand this thing. First F stand for fundus. So this will involve fundus and body. It will involve fundus and body. A for atrophic. It's also called as atrophic type. A for autoimmune. You will find antibodies. अब देखो, antibodies means this, autoimmune means there should be antibodies. So antibody will destroy parietal cells. So antibodies against parietal cells means अब parietal cells destroy हो जाएंगे तो क्या होगा? Pernicious anemia. तो patient can develop pernicious anemia. Now see, parietal cells jobs is to take B12, like they will produce intrinsic factor, and intrinsic factor will take B12 to terminal ileum. तो अब B12 का absorption नहीं हो पाएगा, तो pernicious anemia. Parietal cells also produce HCl. So HCl नहीं बनेगा, we call this achlorhydria. Achlorhydria. So you can see it involves fundus and body, atrophic, autoimmune, pernicious anemia, achlorhydria. And remember here what we have antibodies that destroy parietal cells. Antibodies against parietal cells. So this is about FA. Done. Okay, now coming to mental disease. क्या होता है mental disease? Anyone? What is mental disease? बार बार एग्जाम में क्वेश्चन आ रहा है इससे. So what they can ask you about mental disease? mental disease कहीं पढ़ा था, कुछ सुना लग रहा है इसके बारे में? दिस इज़ लाइक अ टॉपिक विच इज़ बर्निंग. बार बार एग्जाम में क्वेश्चन पूछ रहे हैं, सो आई एम एक्सपेक्टिंग कि आपके एग्जाम में अभी भी पूछा जा सकता है इससे क्वेश्चन. mental disease. So where you will see mental disease, understand this thing, it is basically there is loss of protein. So we also call this protein losing enteropathy. Protein losing enteropathy. और कुछ? anyone? तेजेश, अनुज, anything you know about mental disease? बताओ. कुछ बताया था मैंने क्लास में या पहले कहीं पढ़ा हो? Anywhere else you have studied mental disease? Come on. क्या पूछते हैं? एक ही तो क्वेश्चन पूछते हैं. there is action of a mediator called TGF alpha, right? So there is like increased release of TGF alpha. What else you will notice? You will notice like there is, और क्या मिलेगा? You can notice like prominent gastric fold. So you can see a prominent gastric fold. इनको हम रूगे भी बोलते हैं. We call them रूगे. And remember, in this you will notice there is hyperplasia of a cell. We call them foveolar cell hyperplasia. Foveolar cell hyperplasia. Now try to understand this thing. There is hyperplasia of foveolar cells, and ultimately you will see how we are going to manage. So which drug you will give? We will give cetuximab. Drug that we will choose here will be cetuximab. Okay, now coming to stomach cancer. Stomach cancer के type बताओ. What are the types of stomach cancer you know? कौन कौन से टाइप पढ़े थे आपने स्टमक कैंसर के? कम ऑन. स्टमक में कौन कौन से कैंसर होते हैं बताओ. वी हैव अ क्लासिफिकेशन, इसका नाम होता है लॉरेन क्लासिफिकेशन. सो अंडरस्टैंड दिस थिंग. स्टमक कैंसर, रिमेंबर दिस इज प्रिवलेंट इन जापान. बाकी सब कंट्रीज में इसका इंसिडेंस कम हो गया एक्सेप्ट जापान. वाई? बिकॉज जापनीज अभी भी क्या खाते हैं, दे कंज्यूम्ड लाइक फर्मेंटेड फूड और स्मोक्ड फूड. फर्मेंटेड फूड और स्मोक्ड फूड में केमिकल होता है कॉल्ड नाइट्रोसामिन. So this will produce a chemical. That chemical is called as nitrosamine, right? So understand this thing. We have different subtype. कौन कौन सा subtype होते हैं बताओ, कौन कौन सा subtype होते हैं? ओके, लाइक मोस्ट कॉमन टाइप इज एडिनोकार्सिनोमा, दैट इज ट्रू. लेकिन जो लॉरेन क्लासिफिकेशन दैट इज फॉर एडिनोकार्सिनोमा. सो अंडरस्टैंड दिस थिंग. वी हैव एडिनोकार्सिनोमा. Here we have different subtype, right? So understand this thing. It can occur because of p53 mutation. Yes, it can occur because of E cadherin mutation. p53 mutation से होगा या E cadherin mutation से होगा, right? Now try to understand this thing. Whenever you see stomach cancer patient, this is having like a feature called distant metastasis. डिस्टेंट मेटास्टेसिस मीन्स दूर दूर जाके मेटास्टाइज करेगा. यू विल सी डिस्टेंट मेटास्टेसिस. फॉर एग्जाम्पल दिस कैन गो टू पेरी एम्ब्लाइकल एरिया. उसको बोलते क्या, वी कॉल दिस सिस्टर मैरी जोसेफ नोड्यूल. सिस्टर मैरी जोसेफ नोड्यूल. This can go to your I can say pouch of Douglas. We call this Blummer shelf. It can go to ovaries. When it go to ovary, we call this Krukkenberg tumor. Krukkenberg tumor. And it can go to your left supraclavicular lymph node. We call this Virchow's node. Virchow's node. Done. Okay, now let's talk about malabsorption. थोड़ी सी बात कर लेते हैं malabsorption की. So what are the main diseases which you have to remember in malabsorption? So remember, we have celiac sprue. Second important जो आपको याद रखनी, that is called tropical sprue. Celiac sprue, tropical sprue. Third important disease which you have to remember is called Whipple's disease. Whipple's disease. And fourth one I can say जो आप याद रख लो, this is giardiasis. Just these four are significant. So now let's understand one by one. पहले let's talk about celiac sprue. In celiac sprue, what they ask you like hypersensitivity to barley, rye, oat, wheat. What we call them? We call them gluten. तो पेशेंट जैसे ही ग्लूटेन खाएगा उसको सिम्टम आएंगे. Second important thing understand in celiac sprue, they ask you is HLA. HLA name is DQ2, DQ8. HLA, DQ2, DQ8. Third important thing they ask in celiac sprue is names of antibody. So we have anti-TTG, which we use in practice. It is a sensitive antibody. And we have anti-endomysial. Anti-endomysial. Fourth thing they ask you like what is investigation of choice. It is biopsy. And in biopsy what you will find, क्या मिलेगा biopsy में? Villus atrophy, and crypt hyperplasia. एक और मेरे पास जगह नहीं है, याद रखना. celiac sprue is associated with dermatitis herpetiformis. ओके, मैं यहाँ लिख दे रहा हूँ. It is associated with dermatitis herpetiformis. So these are the things which you should know about celiac sprue. Okay, बात करते हैं tropical sprue की. So tropical sprue, understand here what they will ask you. Remember, they will ask you, this is something which is commonly seen in air travelers. Frequent air travel to tropical countries. Tropical sprue will mainly affect jejunum, and it is due to excess accumulation of E. coli. So understand this thing. अब ट्रीटमेंट में आपको क्या देना, यू विल यूज टेट्रासाइक्लिन. टेट्रासाइक्लिन बिकॉज जेजुनम में क्या होता है, इन जेजुनम व्हाट वी सी, यू विल सी फॉलिक एसिड अब्जॉर्प्शन. तो आपको क्या होगा, फॉलिक एसिड भी साथ में देना पड़ेगा. यू हैव टू गिव फॉलिक एसिड. नाउ कमिंग टू विप्पल डिसीज. विप्पल डिसीज, दिस इज इम्पॉर्टेंट, राइट. विप्पल डिसीज, अंडरस्टैंड. विप्पल डिसीज में आपको क्या रखना है, इट इज समथिंग where we have to remember just two important things. First is the causative agent is Trophirema vippelli. Trophirema vippelli. और याद रखना ये एक बैक्टीरिया है, और ये बैक्टीरिया किस में आता है, इट कम्स अंडर एक्टिनोमाइसिटिस. सेकेंड इंपॉर्टेंट थिंग इज यू विल सी पास पॉजिटिव. You will notice pass positive macrophage. Till now they have not asked you treatment. They can ask you the treatment. We give meropenem. So treatment में आपको क्या देना है पेशेंट को, meropenem, right? Yes, also Hashimoto's. Coming to giardiasis, understand this thing. Giardiasis, understand here. Try to understand this thing. Giardiasis is called great grand old man of intestine. So it is common, especially like there is a travel to Russia. So it is very common. Now try to understand this thing. This is something you will notice. This like accidentally it was discovered by Anton von Leeuwenhoek. You will see like pear shaped organism. इसका शेप कैसा होगा, pear के जैसा. And in treatment what we give, you can use trinidazole or metronidazole. Trinidazole or metronidazole. So this is the treatment of different malabsorption. Done? Am I clear? Am I clear? Yes. Okay, so this is about your malabsorption syndrome which you have to remember. Okay, take a short break of 10 minutes. उसके बाद start करते हैं. We will continue with GIT part and other systemic part, right? So we'll start at 15:25. 17:25. हेलो, हाँ जी, बताइए. ठीक है. Okay guys, now let's talk about some GI infection. थोड़े से GI के इन्फेक्शन के बारे में बात करते हैं. Now try to understand, in GI tract we have different types of infections. So starting with the first infection, they ask you in exam, it is like enteric fever or typhoid. Moving on to second infection which they ask in exam is GITB. And third infection, which is again very important one, so second will be GITB and third is amoebiasis. So now try to understand this thing. So what type of question they ask you in exam? So just try to understand, whenever we see a patient with enteric fever, so they ask you which type of ulcers you will see in enteric fever. So कौन से ulcers मिलते हैं? So in enteric fever you will see longitudinal ulcers. Longitudinal ulcers. In GITB you will see transverse ulcers. And in amoebiasis you will see flask shaped ulcers. Flask shaped ulcers. Now coming to enteric fever, sometime in the skin you can see rose spots. फीवर का जो पैटर्न होगा, कैसा बुखार होगा इसमें, कभी पेशेंट को बुखार होगा, कभी पेशेंट को बुखार नहीं होगा. व्हाट वी कॉल दिस स्टेप लैडर फीवर. This is called as step ladder pattern of fever. Then try to understand in the management part how you will manage. You will give IV ceftriaxone. If it is oral, we can also use Efixim plus azithromycin. Ceftriaxone plus azithromycin. So this will be the treatment part. Now GITB, understand GITB का most important reason. So understand it is either a secondary TB. Secondary TB means पहले पेशेंट को लंग का TB होता, but now that TB have migrated to GIT, or it could be a primary GITB. So secondary means it was a lung TB which now migrated to GIT. Primary GITB, this was seen because of unpasteurized milk. Unpasteurized milk. Amoebiasis, if I talk about treatment part, how you will treat this, so you will use ATT. Treatment will be same. जो आपको TB का treatment करना है, same treatment यहाँ पर दोगे. Flask shaped ulcers, understand these are seen in amoebiasis. Now coming to amoebiasis, look at the screen carefully and try to understand. Initially patient will develop dysentery. पहले patient को dysentery होगी, means दस्त लगेंगे. Now later on sometime, especially whenever patient is alcoholic, then it can convert into amoebic liver abscess. Amoebic liver abscess. And in amoebic liver abscess, understand this thing, patient will have a chocolate color or a brown color pus. तो इसको बोलते हैं chocolate pus. We call this pus as chocolate pus. So this is something which we see in amoebiasis. Done. Okay, now let's talk about polyp. So we have different types of polyp. कई सारे polyps होते हैं. So they ask you in exam like what are the various types of polyps. So just try to understand we have different condition also which can present with polyp. So कौन कौन सी polyps होती हैं colon के अंदर? Anyone? So we can have serrated polyps. We can have hyperplastic polyp. Serrated polyp, hyperplastic polyp. Now understand this thing. Then these are not that significant. Then what we can have like some syndrome which will have these polyps. So what are the syndrome? So they ask you syndrome which they ask in exam. So first syndrome, it's called Peutz-Jeghers syndrome. Peutz-Jeghers syndrome. अब इसको देखो. This is like a defect in STK1 gene. You will notice STK1 gene defect. So here patient will have, patient को क्या होगा? You can notice like patient will have multiple polyps. There are multiple polyps. These polyps are basically hyperplastic polyp, and there is increased risk of colon cancer. And along with polyp, you will notice patient will have hyperpigmentation around lips. So lip के पास you will notice some hyperpigmentation. So this is what we call this Peutz-Jeghers syndrome. Then next important condition which you have to remember is called FAP. FAP means familial adenomatous polyposis. Familial adenomatous polyposis. अब इसको ध्यान से समझो, इससे क्वेश्चन कई सारे एग्जाम में पूछते हैं. So what you know about FAP? Understand this thing. Here you will notice patient will have more than 100 small polyps. 100 से भी ज़्यादा छोटी छोटी polyps होंगी. And these polyps are 100% pre-malignant, means they will definitely convert into cancer. Now try to understand this FAP occur due to APC gene defect. A polyp जब 100% pre-malignant है, तो before these polyp convert into cancer, what we do prophylactic colectomy. तो कोलन को हम पहले ही निकाल लेते. Okay, then let's talk about some degenerative disease of CNS. So हमने एक बार ये पढ़ लिया था. Just let me give you a brief overview of this Alzheimer disease. Name of the protein which is mutated here is presenilin 1. Presenilin 1. Parkinson. So it is occurring due to idiopathic reason, but sometime it can occur because of mutation in LRRK2 gene or Parkin gene. So protein which get deposited in Alzheimer will be tau protein, and protein which get deposited in Parkinson will be alpha synuclein. This tau protein will form neurofibrillary tangle, and this alpha synuclein protein will form Lewy body. Then we have Huntington disease. I told you chromosome 4 CAG repeat, and patient will have something called anticipation. Anticipation का मतलब क्या होता है, इसको समझो. Anticipation means जैसे जैसे पीढ़ी बढ़ती है बीमारी जल्दी होती है और ज़्यादा सिम्टम के साथ होती है. As generation advances, disease occur early and with more symptom. Then we have Friedreich's ataxia. Here you will see GAA repeat. Lou Gehrig disease also called as ALS. ALS means amyotrophic lateral sclerosis. तो इसको देखो यहाँ पे. Here you will see both upper motor neuron and lower motor neuron damage. दोनों का डैमेज होगा. So basically it is SOD1 defect, superoxide dismutase का defect होगा, and there is a glutamate mediated excitotoxicity. Wernicke Hoffman is a rare disease. Creutzfeldt Jakob, I told you it is a prion disease. And यहाँ पर क्या होगा, patient will have most rapid progressive dementia. Here patient will have most rapid progressive dementia. Then okay, she had believed that all men are same. Then she know after MBBS she is saying men 1, men 2A, men 2B, men 4. So they ask you question on men syndrome. Men syndrome means multiple endocrinal neoplasia. So men 1 will be 3P. 3P means patient will have pituitary tumor, parathyroid tumor and pancreatic tumor. Pituitary, parathyroid hyperplasia or tumor and pancreatic tumor. In men 2A there will be parathyroid, MTC, medullary thyroid carcinoma and pheochromocytoma. In men 2B, MTC, pheochromocytoma and there will be like Marfan syndrome like feature, Marfanoid habitus, mucosal neuroma and patient will have megacolon. Men 4 is a rare condition where patient will have tumor of pituitary, parathyroid, adrenal, renal and reproductive. So this is about your men syndrome. Men syndrome means multiple endocrinal neoplasia. Multiple endocrinal neoplasia. Done. And am I clear, guys? Any doubt in this? Done. आगे चलें. Okay, now let's try to understand what else they ask you. They ask you question on rheumatic fever or rheumatic heart disease. तो rheumatic fever से अब आप देखो क्या क्या question पूछते हैं. So from rheumatic fever they ask you causative agent. It is group A beta hemolytic streptococcus. Then they ask you bacteria is having a protein. That protein is called as M protein. This phenomena, this concept is called as molecular mimicry, because the structure of this protein is similar to body's protein. Diagnostic criteria is called as revised Jones criteria. Revised Jones criteria. Then try to understand, whenever we see a patient with rheumatic fever, you can notice like most common valve will be mitral valve. So there is mitral valve involvement. We call this a fish mouth stenosis. Fish mouth stenosis. Sometimes you will see bread and butter pericarditis. Bread and butter pericarditis. Then remember, in rheumatic fever there will be vegetation along line of closure. जो cells होते हैं, the cells, or I can say modified macrophage, these macrophages are called as NHCO cells. These cells are called as NHCO cells, or these are modified macrophage. And sometime you will see in the left atrium you can notice McCallum patch. So these are all the MCQs which you should know of rheumatic fever. ये सारे MCQ किसके? rheumatic fever के. Done? Am I clear? Of rheumatic fever. Okay, थोड़ा सा आगे चलते हैं. Now understand, they ask you question like about MI. आपसे क्वेश्चन पूछते हैं MI के बारे में, means what changes you will see. So after MI, what are the changes you will see? So understand, first changes you will notice. So in MI they ask you question either on changes or they ask you question on markers. So first they ask you first change. सबसे पहले suppose if anybody having MI, so either you will see no change or waviness of fiber. Suppose today you had MI, तो या तो कोई चेंज नहीं होगा या फाइबर में क्या होगी, वेबीनेस. देन देर विल बी कोएगुलेटिव नेक्रोसिस. coagulative necrosis. Then you can notice neutrophilic infiltration. Then there will be macrophage infiltration. Ultimately, you can notice formation of granulation tissue, and ultimately there will be healing, and this healing will be with a scar. अब इन सारे इनका ड्यूरेशन को भी आपको याद रखना है. So understand this thing. This waviness will occur. This waviness will occur in less than 24 hours. So basic less than, I can say 0 to 4 hours. 0 से 4 घंटे में होगा. Then understand from 4 to 24 hours these changes you will notice in less than 1 day. तो उसको आप ऐसे याद रख लो. 1 डे से 1 डे में क्या चेंज हो रहा है? कोग नेक्रोसिस. अब these are the changes from 1 day to 1 week, right? You can notice till macrophage. So macrophage देखो जनरली कब आ रहे हैं? 5th to 7th डे पे आ रहे हैं. And these are the changes which will occur from 1 week to 1 month. Now coming to markers, they ask you an exam. So which marker is the first to increase? So first marker which will increase, it is called as heart specific fatty acid binding protein and ischemia modified albumin. But unfortunately these two are not available in India. Heart specific fatty acid binding protein. तो what they ask you in exam, तो आपके ऑप्शन में क्या मिलता है? मायोग्लोबिन. आफ्टर मायोग्लोबिन क्या बढ़ेगा? ट्रोपोनिन. आफ्टर ट्रोपोनिन CPKMB. Then we have AST. And last what we have LDH. So ये आपको सीक्वेंस याद रखना है. इज क्लियर? अगर मैं आपसे पूछूं व्हाट इज ओवरऑल द बेस्ट वन, तो बेस्ट इज ट्रोपोनिन. बेस्ट मोस्ट सेंसिटिव स्पेसिफिक विल बी ट्रोपोनिन. ओके, अब इसको देखो. देन दे आस्क यू अ क्वेश्चन फ्रॉम MI ऑन TTC टेस्ट, ट्राइफिनाइल टेट्राजोलियम क्लोराइड टेस्ट. So understand, this is a test where you will see like pale or yellow color area. This is the area which is like having ischemia. So this is the ischemic area. But if you see like red color, this red color is viable myocardium or viable tissue. So this red will be viable tissue. This is called TTC test, triphenyl tetrazolium chloride test, which they sometime ask in exam. Am I clear? Triphenyl tetrazolium chloride. Okay, now let's talk about different types of cardiomyopathy. सारे cardiomyopathy को एक बार हम पढ़ लेते हैं. So just I am writing here DCMP, hypertrophic obstructive cardiomyopathy, restrictive cardiomyopathy, and the fourth one will be Takotsubo. So these are 4 types of cardiomyopathies: dilated, hypertrophic obstructive, restrictive, Takotsubo. So understand this thing. Dilated D4 daru. So here most common cause is daru. What are other important cause to remember? It could be postpartum or post pregnancy, right? We call this post pregnancy or post. Sometime it can also occur in meanwhile pregnancy also. We call this so postpartum or intrapartum, right? Then it can occur because of mutation, that is called Titin mutation, because of Coxsackie B virus. Then remember, this can also occur, I can say, because of selenium deficiency. HOCM का सिर्फ एक ही कॉज होगा, that cause will be beta myosin heavy chain. It's a gene mutation, beta myosin heavy chain gene mutation. Restrictive cardiomyopathy, it occurs because of amyloidosis. Now coming to Takatsubo. This Takatsubo cardiomyopathy, understand, it occur due to like stress. So basically it is stress induced cardiomyopathy. It is due to stress induced release of catecholamines. You will see stress induced release of catecholamines. Now coming to second difference which you have to remember. अब देखो second difference is you can notice in DCMP there is dilatation of all chamber. तो you can notice सारे chambers dilate हो गए. So all chambers are dilated. When all chambers are dilated, ultimately this will lead to decrease in ejection fraction. तो पेशेंट का ejection fraction 10-20% के आसपास ही होगा. In hypertrophic you will see ASH. ASH means asymmetrical septal hypertrophy, and SAM, systemic it is called systolic anterior motion of mitral valve. So initially when there is just ASH, so शुरू में क्या होता है, asymmetrical septal hypertrophy, तो पेशेंट को कोई सिम्टम नहीं होता. But all of a sudden patient can develop when it is SAM. SAM means sudden cardiac death. When there is sudden cardiac death, then it can cause death of the patient. देखो ASH means ऐश्वर्या राय. ऐश्वर्या राय alone है, अकेली है, कोई दिक्कत नहीं है, no problem. ASH plus SAM. SAM means सलमान भाई, sudden cardiac death. Simple. Now try to understand. In restrictive cardiomyopathy, you will notice there is infiltration. So we also call this infiltrative cardiomyopathy. Infiltrative cardiomyopathy. Right? Now अब आपसे पूछते हैं कि कहाँ प्रॉब्लम आएगी. तो देखो DCMP में तो सिस्टोल डायस्टोल दोनों खराब हो जाएगा. यू कैन नोटिस हियर यू विल सी सिस्टोलिक एज वेल एज डायस्टोलिक डिसफंक्शन. Systolic as well as diastolic dysfunction. In HOCM, you will notice problem in the diastole. So you will see diastolic dysfunction. Now coming to this, coming to restrictive, understand this thing. Here you will see there is restriction in ventricular relaxation. So this will also cause diastolic dysfunction. Takatsubo cardiomyopathy, understand, it is the only cardiomyopathy which is common in females. बाकी सब males में common है. Here ventricles shape will become like an octopus. So we also call this octopus jar heart. Octopus jar heart, or what we call this? We call this as broken heart syndrome. Broken heart का मतलब यहाँ दिल टूटना नहीं है. दिल किसका टूट रहा है? बॉयफ्रेंड गर्लफ्रेंड वाला नहीं है. इट इज़ लाइक सीन इन पोस्ट मेनोपॉजल लेडी. इट इज़ मेनली सीन इन पोस्ट मेनोपॉजल लेडी. So this is about your cardiomyopathies. Am I clear? Okay, now try to understand what else they ask you in exam. They ask you question on anemia. तो मैं आपको यहाँ पर anemia का approach बता रहा हूँ. Just I am telling you approach, like how to solve a question on hematology. Because they will ask you a clinical case in hematology, definite question in exam. So in MCQ first thing you have to say CBC. CBC दिया होगा. तो CBC में आपको सबसे पहले क्या देखना है? If hemoglobin is less, अगर क्वेश्चन अनीमिया का है, फर्स्ट थिंग यू लुक एट MCV. सो आपको देखना है MCV, राइट. सो MCV वैल्यू इफ इट इज लेस देन 80 इट्स अ माइक्रोसाइटिक अनीमिया. If it is 80 to 100 it is a normocytic anemia. If it is more than 100 it is a macrocytic anemia. तो सबसे पहले first thing in the MCQ you have to see is MCV. So if MCV value is less than 80, understand what we call this? We call this as शीतल. माइक्रोसाइटिक में क्या क्या आएगा? शीतल. शीतल means sideroblastic anemia. Sideroblastic anemia. I is IDA. T is thalassemia. A is AOCD and L is lead poisoning. L is lead poisoning. A point is, now sideroblastic is pretty easy to identify. AOCD आगे जाके this later on it convert into normocytic. This convert into normocytic. तो प्रॉब्लम कहाँ आती है? हाउ टू डिफ्रेंशिएट IDA फ्रॉम थैलेसीमिया. सो इसके लिए आपको क्या करना है, देखो क्वेश्चन में शायद दिया होगा, अगर नहीं दिया तो ये पूछा नहीं है. सो यू नीड टू सी MCV डिवाइड बाय RBC काउंट. जो MCV दिया है उसको RBC काउंट से डिवाइड कर दो. इफ़ वैल्यू इज़ लेस देन 13, अगर वैल्यू 13 से ज़्यादा है, मोर चांस ऑफ थैलेसीमिया. वैल्यू इज़ मोर देन 13, मोर चांस ऑफ IDA. इसको बोलते हैं मेंजर इंडेक्स. सो अंडरस्टैंड दिस थिंग. फर्स्ट थिंग व्हाट आई टोल्ड यू, फर्स्ट थिंग, अगर MCV की वैल्यू कम है, पहले इसकी बात करते हैं, कम है. फर्स्ट थिंग यू हैव टू सी इज MCV वैल्यू अगर कम है तो सेकंड थिंग यू हैव टू कैलकुलेट इज मेंजर इंडेक्स. सिंपल. If suppose value is given like 105, 108, 1010, so understand this thing. In this case, it is macrocytic anemia. So macrocytic anemia, what are the main causes? It could be due to B12 deficiency. It could be due to B9 deficiency. It could be due to liver disease. It could be due to थायरॉयड डिसीज. सो बेसिकली जो आपको याद रखना है एग्जाम पर्पस, B12 एंड B9, B12 एंड फॉलेट. सो नाउ अंडरस्टैंड, इफ इट इज़ अ नॉर्मोसाइटिक अनीमिया देन दे मस्ट हैव गिवन यू MCV वैल्यू इन द नॉर्मल रेंज. डन. सो ये आपको याद रखना है अनीमिया का अप्रोच. नाउ कमिंग टू इफ हाउ यू विल सॉल्व अ क्वेश्चन ऑन मल्टीपल माइलोमा. तो देखो मल्टीपल माइलोमा का क्वेश्चन आपको कैसे सॉल्व करना है. यू नीड टू सी प्लाज्मा सेल्स. So clonal plasma cells, they should be more than 10%, or there is a biopsy proven, plasma cell tumor, or we can say plasmacytoma. या तो प्लाज्मा सेल्स 10% से ज़्यादा या बायोप्सी में प्लाज्मा सेल का ट्यूमर प्रूव हो गया है. प्लस this is not sufficient, we need some more thing here. Plus we need crab feature. We need some crab feature. So crab means crab क्या है? C for calcium. So patient का कैल्शियम ज़्यादा होगा, patient will have hypercalcemia. R for renal involvement. R for renal involvement means patient का BUN बढ़ा हुआ है. A for anemia. B for bony lesions or lytic bone lesion. So understand this thing. So multiple myeloma diagnose करने के you need plasma cells more than 10%. Now compare this. Acute leukemia कैसे diagnose करोगे? So question में आपको ध्यान से in a clinical case you have to identify few things. Acute leukemia, how you will identify? So understand. In case of acute leukemias, what you need to see, आपको क्या देखना है? You have to see the cells. If you see blast cells in acute leukemia, blast cells will be more than 20%. Blast cells 20% से ज़्यादा होना चाहिए. Second thing, second approach is simple. If you see, if cells are stained for MPO or Sudan black, MPO and Sudan black, or these cells are stained for PAS and TDT. इसको समझो, try to understand. Suppose blast cells are given more than 20%. अगर MPO Sudan black से stained है, then it's a myeloid leukemia. Means ये M वाला है, means AML. If it is positive for PAS and TDT, then it is lymphoid leukemia. देखो मेरी बात ध्यान से समझो. Suppose अगर मैंने आपको बोला, if I'm telling you, because this is the point where student make mistake. गलती कहाँ करते हैं बच्चे? What mistake they do is कि बूढ़ा आदमी देखा क्रोनिक ल्यूकीमिया, यंग देखा एक्यूट, ऐसा नहीं होता. So this is the wrong way to solve MCQ. Understand this thing. Old people can also have AML. They can have ALL even. So understand this thing. You have to see blast cells more than 20%. Suppose they mention you like lymphoblast, means blast cells more than 20. Then they are telling you these are blast cells. Suppose they are mentioning blast cells are 25%. Then they are telling these cells are stained for MP and Sudan black. तो ब्लास्ट सेल्स 20 से ज़्यादा है, एमपी ब्लैक मीन्स कौन सा होगा, माइलॉइड. सो इट इज़ AML. अगर आपको सपोज ऐसे दिया ब्लास्ट सेल्स आर 16% एंड दे आर पॉजिटिव फॉर एमपी एंड सुडन ब्लैक, तो अब ये क्या होगा, नाउ इट इज CML, इट इज नाउ क्रोनिक. गेटिंग मी और नॉट? सिमिलरली फॉर पास एंड टीटी व्हाट वी हैव, दिस इज lymphoid cells. So this is the way to solve a question on acute leukemias. Am I clear? Am I clear? Am I clear guys? Any doubt? Any doubt to anyone? समझ आया? बिकॉज दिस इज़ वेरी वेरी इंपॉर्टेंट. आपसे एग्जाम में क्वेश्चन पूछते हैं और ये गलती बार बार होती है. दिस इज अ मिस्टेक विच मेनी ऑफ यू मेक इन एग्जाम. डन? Okay, so with this we will conclude. I think this much is sufficient for your revision. This PDF will be shared. Just remember, what I can suggest is just give your best shot. It was nice to interact. All the best. Just last few days पॉजिटिव रहो. जितना पॉजिटिव आप रहोगे उतना अच्छा होगा. एंड जस्ट रिमेंबर, खुद को कम समझना बंद करो. यू डिड दिस बिफोर. तुमने पहले भी किया हुआ है, 10th में किया है, 12th में किया है, अब भी होगा. जस्ट मार्क माई वर्ड्स कि परेशान सब होते हैं, नर्वसनेस सबको होती है, डर सबको लगता है, लेकिन डर के आगे जीत होती है. जस्ट ट्राई टू अंडरस्टैंड दिस थिंग. जब आप दुनिया की इतनी डिफ़िकल्ट लैंग्वेज पढ़ सकते हो, जब क्लास 10th 12th निकाल सकते हो, दिस इज़ मोर ईजियर दैन दोस. So remember, you can, you will. This is from my side. All the best. Thank you so much. It was my nice interaction from all of you. I hope you will get some help in your exam. See you now where either in some hospitals or in some PG classes. Okay, all the best. Bye-bye.